I am just letting a few more people join. Good morning. Good morning. I hope wherever you are located, you are enjoying this sunny day. We cannot thank you enough for joining us today for this awesome day of family education. My name is Rachel Lieberman. I am the director here at the Celiac Disease Center at University of Chicago. We are so happy to have all of you today. Welcome and happy Celiac Awareness Month. We've had a robust schedule. I hope you've been able to join us for some of our other education. And if you haven't, just a plug, all of our education from this month will be on our YouTube channel. I just wanted to first welcome with my colleagues. I have with me today Lindsay Yakel, who is our educational coordinator, who has done a tremendous job putting this entire day together. We want to thank her, and you will hear from her throughout this morning. So I'm very excited to have her, as well as Dr. Ritu Verma, who is our medical director here at the Celiac Disease Center and chief of pediatric gastroenterology here at University of Chicago's Comer Children's Hospital, and resident amazing celiac extraordinaire. So we love having Dr. Verma with us always. And I just want to go over a few housekeeping notes with everyone. We have a Q&A function at the bottom of your screen of this Zoom. That is where we would love for you to put all of your questions. I think rather than use that chat function, it's much easier for us and for our speakers if you put all of your questions into that Q&A function. At the end of each talk, we will have a few minutes to go over questions and answers. And please know that if we don't get to everything, we will be sending up follow-up information. This, as I noted, this presentation is being recorded today. We ask that you stay off camera or speaking. That is for our presenters, but utilize that Q&A function throughout the day. And we are excited to have so many speakers. Lindsay, have I forgotten anything before I keep going?
No, I think that's it. I think we're ready to go.
Awesome. Well, I don't want to waste any time. I would love to welcome within our first section of this morning, that medical section of our family education day. We have Dr. Ritu Verma, who I mentioned before, who is our medical director here at the Celiac Disease Center. And what I'm really excited about is Dr. Verma will be talking a little bit about clinical presentations, diagnosis of celiac disease, as well as the importance of follow-up care. And finally, I am so excited because Dr. Priyanka Chu, who is also Dr. Verma's daughter, will be joining us and talking about family coping styles. So throughout this section, it's going to be all in one. These presentations will kind of meld together, but at the end, we'll be addressing questions. So again, I want to remind you, please use that Q&A function. And Dr. Verma, I am really excited to turn it over to you this morning.
Thanks, Rachel. Thanks, Lindsay. And yes, it's a lot of hard work on Lindsay's part and Rachel coordinating and corralling us together so we can put this program together. So it's really an honor and a pleasure to be here today. Honor is to see all of you, and a pleasure to actually do this with my daughter. The theme that we really wanted for this day today is learning a little bit about celiac disease. So it's not going to be a very heavy medical kind of thing, but it's going to be a very heavy coping. How do we cope with this condition? But prior to coping with that, I'm going to try and see if I can get my slides on, and you'll see my skills here, where we're just going to talk a little bit about what is celiac disease, why do we really need to worry about it, and then we'll segue into some coping family dynamics. So just as a refresher for some, and maybe some who've just been diagnosed, for everyone to know that this is an autoimmune genetic condition. So meaning it runs in families. It's really not an allergy. It's something that affects your gut, but affects other parts of your body as well. And it can be seen in anyone, in any ethnic background. So it's not just limited to one kind of population in the world. And it can occur at any age. Any age that is eating gluten and has the genetics can develop the disease. And very important for people to understand that it is different than a gluten allergy. So if you have a gluten allergy, you see an allergist. An allergist does the testing, The symptoms can be very similar to celiac, but you have more of the testing done from an allergy standpoint. And we'll talk a little bit about the blood tests that are done in celiac disease, and those blood tests are usually not abnormal in a gluten allergy. And the treatment for an allergy, of course, is you don't eat those particular foods. And more important to remember that this is not non-celiac gluten sensitivity. And in that case, what I mean is people eat gluten, they have the symptoms, but they do not have the blood tests that are abnormal, and they do not have the antibody biopsies. If it's done, the biopsies are not abnormal either. So you feel better on a gluten-free diet, but you do not have the associated autoimmune issues that go on with celiac disease. So those people with non-celiac gluten sensitivity can have some gluten in their diet, but not anything else. So why is it important? Why do we really need to worry about this? So really, I think the long-term complications are what we are concerned about, besides the short-term symptoms of pain and so on. And in my mind, and I know that all the patients that I see will be smiling, because I always tell them the reason you're on a gluten-free diet is not because you have a bellyache or you have diarrhea, but because if you continue to have gluten in your diet on a regular basis, you're at a higher risk for developing another autoimmune disease. So it's very important to have the diagnosis made and the correct treatment to be paid so that you are not at a high risk for other diseases. So we need to understand the symptoms, and the symptoms are so varied, and that's why people will often get diagnosed much later, because if the symptoms can be bloating, it can be pain in your belly, it can be constipation or diarrhea. So it's often very confusing. And then there's some people who have absolutely no GI symptoms, and instead they have a rash. So they go to a dermatologist. And if you don't have a GI symptom and you have a rash and you have a dermatologist who's not aware of this particular rash, your diagnosis could potentially get delayed. So I would say not to get annoyed with your clinicians, because the symptoms are so varied, but it's important for the clinicians to be able to hear out what the families are saying and keep an open mind and get the diagnosis for celiac disease made. So you can have weight loss, you can even have weight gain. So again, weight loss is not the only thing that you can say. If you're not having weight loss, you don't have celiac disease. That is not a true statement. Persistent tiredness, and often in this day, we all feel very tired. So it is tiredness that is beyond the norm. That would be another symptom that you would have for celiac disease. And we should not forget the neurological symptoms. So there are people with depression and anxiety, chronic headaches, not one headache here and there, but chronic headaches, brain fog, all of those could be symptoms of celiac disease. So how's the diagnosis made? So first of all, you have to think about the disease, and then you get the diagnosis made. And it's the first thing one does is a blood test. And then these are the blood tests that we usually will recommend as the first test. And these look for different antibodies. So anyone who's been diagnosed or has been screened for celiac disease will know that they get this thing called the TTG, or tissue transglutaminase. That is the screening blood test that's done. So the TTG IgA, so long as your total IgA level is normal. And if you're with a clinician, they can explain that to you more. But you want to look at the IgA level, that's an immunoglobulin A level. You want that to be in the normal level range. If it's high, that's okay. If it's low, you might need to do other blood tests, and you look at the tissue transglutaminase IgA. If your TTG IgA is high, then there's a concern for celiac disease. So that would take you to the next step. There's also a genetic test that can be done. The genetic test only tells you that you are predisposed to this condition. It does not tell you that you have the disease. So just having the genetic positive for celiac disease does not mean that you have celiac disease. And in fact, there are many people who have those genes and never, ever develop the disease. So having an HLA positive does not mean you go on a gluten-free diet. So if you have the blood tests that are abnormal, what do you do next? Don't start a gluten-free diet. Have a discussion with your clinical team. Often what we recommend is to get an endoscopy and a biopsy done. But many of you may be reading about guidelines from Europe and guidelines from North America being different. So there is a wave in this country. It's definitely a wave in Europe where If your blood tests are very high, very abnormal, that you may not need a biopsy and you can start a gluten-free diet. But again, remember, don't do this on your own. Have a discussion with your clinician. Get the pros and cons of whether you do a biopsy or not a biopsy. What does it mean? If you don't do a biopsy and start on a gluten-free diet and 6 years down the line, you really want to know, do I have damage or not? You would have to introduce gluten back in your diet. So again, it's a discussion with your clinical team based on what you feel comfortable as a family, what your clinician feels comfortable as a family, and then proceed with whatever you need to do, biopsy or no biopsy. But please have that discussion. I can also tell you here that there's a lot of research happening to actually look at other blood tests as well. So these are what we have now, but there will be down the pipeline other blood tests that can be done for diagnosis and follow-up that might be more precise than these. So that's for the future. So who should be screened? Obviously, the patients with symptoms. And then there are some conditions that are very associated with celiac disease, like type 1 diabetes, Turner syndrome, trisomy 21. Just to focus a little bit on type 1 diabetes, almost 8 to 10% of people with type 1 diabetes end up with celiac disease. So one of the mandates is that every person who's diagnosed with type 1 diabetes gets screened for celiac disease, symptoms or no symptoms. And then, as we talked about earlier, this is a genetic condition. So family screening is extremely important. So if one person is diagnosed in a family, the rest of the family needs to get those blood tests done. So once again, I can't emphasize more. Do not start a gluten-free diet prior to completing your full workup, the blood work, and a discussion about the endoscopy. Please, otherwise you'll be kind of going back and forth and causing a lot of confusion in your mind. So what's the treatment? So currently, the only treatment we have is a gluten-free diet, and that means avoiding wheat, rye, and barley. And sometimes it gets easy to do, and sometimes it gets confusing to do, and we'll talk about it much later. But again, the main food groups are wheat, rye, and barley. And one of the things that always stumps all of us is malt. So malt is usually not labeled as gluten. So if there is anything with malt, please don't eat that. So you cannot have any foods lifelong, wheat, rye, barley. Some people would say, oh, it's going to be very easy. I just don't eat the loaf of bread. But it isn't as easy as that, because you also have to avoid cross-contamination. So we do know that if foods are fried in fryers that have gluten in it, or they're made on the same sort of grill, or your gluten-free pasta is boiled in the same pasta as regular pasta, it gets enough gluten in it that would cause a problem long-term as far as acquiring other autoimmune disease. But remember, it's not one-time cross-contamination. It's repeated cross-contamination that would be a concern. So part of the treatment is learning how to read labels, learning how do you live in this world to avoid cross-contamination. But there is good news, especially the young ones, just for you to know. There are other options in development. The pharmaceutical companies are working really hard in trying to get other medications. And there are a couple of medications that are on the horizon. One of them would be where you could eat the food, but you would eat gluten-free food, but you wouldn't have to worry as much about cross-contamination. So that's sort of in the horizon. And then there are other medications that perhaps you might be able to eat some gluten. So don't lose hope. There are other options in development. But again, get to the clinical trials. You know what needs to happen. So now here's the treatment. So what happens? You get diagnosed, you get treated. It's very important to follow up. So don't just say, all right, I got treated, goodbye, I'm done with this. No, it's very important to follow up. And here's your team. This is your team. These are people in your corner. Your primary care physician, the psychologist, gastroenterologist, maybe a little bit, the nursing team, dietitian, and social worker. This is all your team. So why should you need a follow-up? People will say, I know what to do with this diet. Well, you've got to monitor all the complications of celiac disease. When I talked about in one of the first few slides, there are long-term complications that can happen with celiac disease. The gluten-free diet is not easy. You need to monitor complications from there. And then, of course, when you come in for follow-up, you learn more about future therapies. You get the real information about what clinical trials are out there. How do I get involved with advocacy? And that is part of what we need to do. So what happens at our celiac center here? With children, I'm a pediatric gastroenterologist. We always follow the growth, height and weight trends. We manage other GI symptoms as well. We just don't talk about gluten-free diet. We also talk about what else is going on with the child, what else is going on as far as other symptoms. And then we work with our dietitians and psychologists in terms of working with you on how to comply with the gluten-free diet. If you have any questions, you've gone to the supermarket and you found something, let's talk about that at the follow-up appointment. And then very important that you need follow-up blood work done. So remember, you had a blood test done that was abnormal. We need to follow that over time. It kind of helps us look at compliance of the diet. And then we look at various vitamin levels. We get thyroid, you know, there are complications that can happen in terms of thyroid, liver disease, type 1 diabetes, and things like that. So we follow all of these in the follow-up lab. So again, this is something that's discussed. We're extremely keen on talking about what happens in your life. So you might be going from primary school to high school. Let's talk about how are you dealing with that? How are you dealing with eating out? Do you have a dual kitchen at home? How do we work with that? With the family events, we assess the diet compliance. All of this happens in the follow-up appointment. And I think more important is the education. So if you were diagnosed at 5 years of age and now you are 12, the education is going to be different, right? So I used to be at Children's Hospital in Philadelphia, and we had one of our nurses, and I want to give a shout out to her. Her name is Karen Hilwack. She would do this teaching. So even if you've had original teaching happen at 2 years, 4 years, 5 years, she would come and tell me, Dr. Verma, does this child and family need a refresher? And she would give a refresher education, a quick education based on the child. If you are now in high school, your celiac education is different than when you were diagnosed with 2 years of age. And that's what we are getting through at our center here as well in Chicago. But I really want to give a shout out to Karen, who really started this whole thing with trying to do based on the age group, even if you've been diagnosed for 10, 12 years. The education is there for the siblings, the education is there for the caregiver. So we totally encourage that when you're coming for a follow-up appointment, come with everyone who's involved in the care. So the siblings, don't forget the siblings. The siblings are equally affected as the child who has celiac disease. And then we talk about 504 plans. And for our center here, Lindsay, you met her earlier today. Lindsay is the liaison to discuss about 504 plans, and we have a college planning thing as well. Family screening, don't forget. We do a lot of family screening, and that's important to do so that we figure out if there are other family members who have celiac disease or not. And as you heard earlier, Priyanka is my daughter, and she was one of the people who got screened for celiac disease and ended up with celiac disease. I'm going to now introduce her back on so she can talk about how our family coped, and maybe we can give some tips to people. So Priyanka.
Hello, everyone. Thanks for having me to talk a little bit about our experience. So like my mom said, my name's Priyanka, and I was diagnosed with celiac disease when I was 12 years old. And that was through family screening. So you can see us here. I'm the one in the middle. My younger brother, he's the youngest. He was diagnosed based on symptoms. So he was pretty sick at the time of his diagnosis. He was 5 or 6. I can't even remember now. But he went through the whole process of diagnosis and everything that mom mentioned. And then, came the time for all of us to get screened, and we all got our, antibodies tested. And then we also all got genetic testing too. And it turns out everyone in our family actually has the genes, parents and the 3 of us, but only my brother and I had the disease. So it was a little bit of an interesting dynamic, sort of trying to figure out having 2 kids with celiac disease and one, my sister Nika, who does not have celiac disease. And so we had to go through a lot of iterations of our kitchen and our foods, and mom can talk a little bit about how that was as a parent.
So, it was tough. And I think initially, as every parent who's on this Zoom call today will feel that stress. So I think for me, it was actually not stressful because my son was very ill. So to find out that he had celiac disease and nothing else was actually a blessing in disguise. And finding out that Priyanka had celiac disease was maybe not a blessing because she had absolutely no symptoms. But nevertheless, so because my son was so ill, I went a little crazy and took everything out of the house that had gluten in it, totally everything out of the house, because I really wanted to just protect these 2 children. And there was nothing allowed at home that was that had gluten in it. And then, I think one of the things that some people have heard me talk about is the shopping. So at that time, I mean, this was many years ago, so the food availability was not as much as we have now. So we used to order a lot of bread from Canada, from one of the companies there. It was really delicious bread, but we had to order from there, and sometimes it would come on time and sometimes not. And in the summer, it would be melted. So, there were all sorts of things that we had to deal with. We would spend weekends baking. But one of the things I clearly remember is that I used to go shopping for groceries for the household, and would take my young middle daughter because she did not have celiac disease. I didn't take the other two with me because I didn't want them to feel bad going into a grocery store and seeing all those gluten containing foods. So I wouldn't take them with me. I would take her. But what I would do is she would see all the gluten containing foods, and I would walk right by them and say, come on, let's go find something for your siblings. Let's go find something. And I think I did wrong by her, really wrong by her, by not bringing anything into the home. And we eventually transitioned. And I think Priyanka can maybe talk a little bit about what happened when we transitioned with some gluten at home. How did you feel?
So yeah, I was okay with it. I think I was a little older, but I think it was nice. At first it was a little anxiety inducing to figure out, how we'll do it. But thankfully we have enough space and the resources in our house to be able to make a section that had gluten. And it's funny because you probably think that, for the people who have, celiac disease or who are gluten-free in other homes, that their section would be smallest, but actually our section was the whole house of gluten-free. And then my sister got her area with all of her gluten containing things, her own toaster, and then her snacks. And I think that made things a lot better for us, just in terms of our relationship with each other, my siblings and I, and for the most part, still ate gluten-free at home. We'd make pasta, we'd eat everything together, but, she would get to have her snacks, or she would get to have her, her gluten containing bread. And she learned how to kind of, organize and manage those things on her own. And really, she became our biggest advocate through all of this. I think that she, I'll talk about this later in the day, but you get really exhausted sometimes having celiac disease and having to talk about it all the time and think about it all the time. And as we kind of worked together to come up with a way that worked for us in the home, she really became the biggest advocate for me and my brother, and for figuring out how to eat gluten-free, and especially when we're exhausted of talking about it all the time. Like even a more recent example, when I'm a resident in general surgery, and when I was applying for residency, I was traveling around the country, having to go to different places to interview, and I would get so exhausted at the end of the day and not be able to think about eating gluten-free, finding gluten-free food. And Nika would call restaurants across the country for me and tell them what I needed and find things for me and order me dinner. And just after having these conversations and after kind of getting into a better system of a dual household, there was no longer this tension or animosity between us. And I mean, we were kids, but and it's helped us kind of grow into a place where we can actually really support each other. And I think our nuclear family has become really supportive. And then the other challenge that sort of developed was our extended family. So we, have two sides of the family, mom's side and dad's side. And I think it was very interesting to see the way those both sides kind of took the information. I think that, one side of our family has a lot of people with other food allergies. There's a lot of medical issues on that side. There's also a lot of physicians on that side of the family. And so there was a high health literacy on that side. And that side of the family coped really well. They kind of took the information. They, it wasn't very hard to bring in gluten-free things onto that side of the family and to feel included at a lot of our social events. But then the other side, wasn't quite the same. There wasn't a lot of history of knowing about diseases like this, and the health literacy was a little different there too. And so explaining what this meant was very difficult. And especially for us, we come from a South Asian Indian family. It wasn't something commonly talked about or known about. And so and there are certain foods that are gluten containing, I mean, as in many cultures. And so for us, trying to say, no, we can't have that item, or no, you can't touch that item, and then, we can have other food, was kind of a barrier at first to sort of doing social functions and things with that side of the family. I think that over time, we've, continued to advocate for ourselves, mom and dad, and Nika and my brother and I have really advocated for, no, this is actually what we need. We've been for years now. I mean, it's been 19 years. So for years now, we've been bringing the gluten-free food to family events. And I think, it didn't take 19 years for this to happen. It happened sooner, but, there was a slow kind of understanding. It sort of just was pervasive through everything that we did. We were like, okay, we're bringing our food. This is our food. And people came to know that. And I think, now over time, all of our family has a much better understanding of what it means to be gluten-free and to have celiac disease. And there were some bumps along the way for sure. There was a number of times where we had to have these awkward conversations of like, is that gluten-free? How did you cook it? Those sort of things that are difficult. But I think that it's taken some time, but we've definitely gotten to a much better place of coping in terms of supporting us. Although then there's the other barrier that maybe Mom, you can talk about is talking about family screening in a bigger sense, right? Like I was diagnosed through family screening. So clearly that's something that needs to happen for the extended family. And that wasn't maybe as straightforward.
And it's tough, when you have to tell people. I think you can tell your own nuclear family that you need to be screened. But it's our duty to let others know and see if they will go follow through with that. And yes, sometimes it gets frustrating to have people not follow. But again, it's one of those things you can only advise. And just, as an aside, with the family screening, I actually have one of my nieces on my side and another niece on the other side that has been diagnosed with celiac disease as well. And who knows how many more. But it's important. It's our job to tell people. But I think one of the things that we all have to remember, it is exhausting to go through with that. But I think if we keep on educating our families, eventually it does work. But I think at the beginning, you just have to take your own food or eat the food. And I used to always carry a foil. That was always in my car. The foil was there. If I'm somewhere and I have gluten-free bread, I can put it in anyone's toaster and toast it for them so that the children would have some food. So I think there are coping mechanisms that we have. And there's a lot more that we can talk about, but it'll go through the day as you'll hear other people talk about it as well. And I know we've gone over time, so I apologize for that, but hopefully we've given a little snippet of what it is to cope with this, or at least something about celiac disease and coping in a family.
Thank you. Thank you. That was great. Great information. We want to take a couple of minutes to do some questions and answers. So if people want to submit a couple of those, we won't have time to do a whole lot, but we can take a couple. You can put those into the Q&A box, not the chat. Chat gets too hard to keep track of. So we do have a couple in here now. And the first one is, what is the medical recommendation on extended family screening?
So first degree, second degree relatives is where you want to sort of extend that to the celiac screen. So looking at the antibodies.
Okay. I guess they're all sort of along those same lines. This one is a little bit more specific. How far out into the family should they go? Cousins, aunts, uncles, grandparents, a little bit more.
Yes. So, if let's say there's a mom who is genetically positive, then of course her parents and her siblings should be tested. So any first degree and second degree relatives need to be tested. So yes, mom, parents, grandparents, first cousins is where you go to.
Okay. And the next one is, who is it that people should be going to for their education on celiac disease? Is it the doctor? Is it a dietitian? A little bit of advice on who should be educating them.
I think it depends on which part of the country you're in. Everyone does it a little bit differently. If you're in a big celiac center, it's, as I mentioned earlier, that's your family, your support. So you have the gastroenterologist, you have a dietitian, some centers have psychologists, some centers have educators. So it really depends on where you are. If it's a smaller group, it might just be the physician and dietitian. If it's a bigger center, you'll have more people, there'll be educators and so on. So it can be anyone who really knows about celiac disease and knows the facts and not necessarily, read offline or something like that. So it can be anyone, but the ideal is you have a gastroenterologist, dietitian, educator, psychologist, ideal.
Okay, and this one's asking if acne is a significant, or is significant acne one of the symptoms of celiac disease? Could it be?
It could be, but acne has so many other reasons as well. So I think this is a question that probably should be individualized and speak with your own physician. But I always say, you know what, if there is a symptom that you don't have an answer for, and you're getting blood tests done for so many other things, add a TTG to that. I don't think it is harmful in any way to add that, but acne is secondary to so many things. So I wouldn't have someone just start on a gluten-free diet and see if the acne improves.
Okay, somebody else is wondering if you can explain how to do a gluten challenge. They've encountered differing opinions about the amount of gluten to eat.
And part of the reason is because there are no standardized gluten challenges out there. There will be something that the pediatric group is putting together and hopefully publishing soon. So what most of us will do is talk about, there are grams of gluten that people can talk about, but again, that's you want it in practical terms. So depending on the age of the child, so I'm assuming someone is, well, we can go through adult and child. So we look at anywhere from, depending if it's a very small child, 1 slice of bread equivalent to anywhere to 4 slices of bread for an adult. Now, again, different breads have different amounts of gluten in it. So you want to look at and make sure it's a high gluten bread that you're getting. So you need to take 1 to 4 slices of bread, every single equivalent of that. So you don't have to eat bread, but you could eat something else, equivalent of that for about 4 to 6 weeks. That's what we have currently. As I said earlier, that for the future, we will have other tests that are available that the challenge will not need to be so prolonged. And that's something that we're all working on, to be able to look at what other tests that we can look at, what cytokines can we look at, so we don't have to do this prolonged challenge. But currently, the state of affairs for gluten challenge is confusing. So very important that you talk to your physician, because again, we say 4 to 6 weeks, but if you're having a lot of symptoms, then you need to talk to your physician in terms of what can you do with the challenge to tailor it a little bit differently and then get the blood test done. So it's very hard to discuss a challenge in a forum like this unless you know the person and you have a physician who can actually guide you through that. But in general, you want about 4 to 6 weeks, so long as you're not having symptoms. And also, if you can do it longer, that's fine. Equivalent of 1 to 4 slices. Now, I personally do not recommend bread, only because I tell people that if you've eaten gluten-free bread and then you're told to eat regular bread and then you have to go back to gluten-free bread, that is torture. That regular bread, that taste that you're going to get, I think is so unfair. So I will never suggest bread. The tests, the studies, everybody talks about bread. I will never do that. I usually go with flour. So if you get Vital gluten flour and you start with a teaspoon a day, build it up to 3 teaspoons a day. So build it up to that if you can, and then stay on that for that 4 to 6 weeks and get your blood test done. If you don't want to do flour, then maybe pasta is a better choice, because I think gluten-free pasta is not bad, but I'd never do bread, because I think it's torture to have that poor child go from gluten-free to regular to gluten-free and not allowed. I'm sure Priyanka would agree with that. So really, for a challenge, please don't do the challenge on your own. Talk to your team. It's so important that you talk to your team.
Okay, one last question and then we'll move on. This one is, their celiac son has developed iron deficiency without anemia and is taking iron infusions. Is this one of the celiac symptoms, and what can we do about it?
So the first thing I would want to know is the celiac disease under control? If your celiac disease is under control and you still have iron deficiency despite adding iron, then look for another reason for that iron deficiency.
Okay.
If your celiac disease is not under control and you've just started on a gluten-free diet, then the iron infusions will help you build up the stores, and then you should be able to get off that because the gluten-free diet will then help heal the intestine and you'll be able to absorb the iron. But again, remember, meet with your dietitian because the gluten-free foods always don't have enough iron in it. So long-term, you want to make sure once you're done with your iron infusions that your diet has enough iron in it as well.
Perfect. Thank you. Thank you for all that.
So
Oh, you're welcome.
Lindsay, I know I see so many questions populating, which is amazing. And we will try to get to these during the day. Throughout the day, we do have speakers. I want to get to because we have such a wonderful schedule for today. And it is truly my pleasure to introduce our next speaker, who is Dr. Jennifer Wilds, who is here with us from the University of Chicago. Dr. Wilds is an associate professor of psychiatry and behavioral neuroscience. And we could not be more honored to have her join us today to speak about the topic of disordered eating. And Dr. Wilds, I would love to welcome you on screen and to get things going, but we are just so happy to have you this morning.
Thank you so much for that kind introduction. Let's see if I can share my screen. Can you see that presentation?
Yes, that's good.
Great. Okay. Well, yes, thank you so much for having me. I'm really excited to come here and speak to everybody about disordered eating. And just to kind of jump into it and make sure that we're all on the same page, I wanted to just kind of explain what do I mean by the term disordered eating? What is disordered eating? So disordered eating refers to problematic eating or weight-related behaviors that do not meet criteria for an eating disorder. And these behaviors often are accompanied by negative thoughts about weight, shape, or eating. So you think about like being dissatisfied with your body, not liking it. People talk about feeling fat, quote unquote, or strong desire to lose weight. Being afraid of certain foods or avoiding foods and feeling guilty, anxious, or disgusted about eating. So in terms of just examples of disordered eating, one example is food avoidance. So this is avoiding entire food groups, macronutrients, or foods with specific textures or colors without a medical reason. And so that's particularly important when we're thinking about celiac disease, because of course there is a medical reason to avoid foods with gluten in it. And so when we're talking about disordered eating, we're talking more about people avoiding sort of the stereotypical would be like high fat foods, high sugar foods, calorically dense foods. On the other end of the spectrum, feeling out of control over your eating. So loss of control, that sense that you can't stop eating once you've started, or you can't prevent yourself from eating. And this can sometimes be a component of what we call binge eating, where you're feeling out of control and you're eating a large amount of food at the same time. Skipping meals or fasting to lose weight, so meal skipping. Following strict rules about what or when to eat. So examples of that might be having a certain calorie limit, like I won't eat more than 1,000 calories a day, or rules about when you should eat. I shouldn't eat after 8 p.m. or I shouldn't eat until 4 o'clock in the afternoon, that kind of thing. And then finally, what we call compensatory behaviors. So these are behaviors that people engage in an effort to make up for eating or to sort of use up calories. So exercising excessively, misusing medications. This might be things like laxatives or diuretics, water pills. A more serious form of medication misuse might be misuse of insulin in people with type 1 diabetes, or you making yourself sick or making yourself vomit in an effort to get rid of the food that you eat. So why do we care? Why is disordered eating important? Well, disordered eating negatively impacts the way people feel about themselves. It is associated with lower self-esteem, depressed mood. It can negatively impact social relationships. Again, think about like if you have all these sort of rules or fears around food, it makes it difficult to socialize with people, because food is an important part of how we socialize. Disordered eating also can affect physical health. So even if it doesn't meet criteria for an eating disorder, disordered eating symptoms can be associated with a whole host of negative physical health outcomes. And then perhaps most significantly, some forms of disordered eating actually do increase the risk for development of eating disorders. So these are things like, strict dieting and food avoidance, serious body dissatisfaction, something we sometimes call internalization of the thin ideal. So the basically really buying into the idea that it's very, very important to be thin. So why am I here? Why might disordered eating overlap with celiac disease? As you all know, celiac disease requires, or management of celiac disease requires food avoidance and strict control over eating. So there are certain things that, we wouldn't normally advise people to do that have to be done in order to manage this illness. In addition, some of the GI symptoms that can be associated with celiac disease can contribute to fear of food or body image disturbance. So, it's common for people, regardless of their celiac disease status, to want to avoid foods that make them feel sick, or even become adverse to foods that have made them sick. At the same time, if you're feeling bloated or distended, that can certainly contribute to negative body image. Weight gain following dietary changes can lead to increased body dissatisfaction. If you're making dietary changes and you're gaining weight, that can, in some people, increase their sense that they don't like the way their body looks anymore. And then finally, there is some evidence that there are shared genetic factors involved in risk for celiac disease and eating disorders, especially anorexia nervosa. Some of the most recent genome-wide association studies have found that these illnesses do seem to load on similar genetic factors, which would then suggest that there's just an increased risk biologically. So what do we know about disordered eating in kids with celiac disease? Well, I think the first thing that's really important to bear in mind is that most children and adolescents with celiac do not have disordered eating. So this is not, having celiac does not mean that you are going to have disordered eating or that your child is going to have disordered eating. This said, rates of disordered eating and eating disorders are elevated in kids with celiac compared to the general population. And so, one of the largest studies that looked at this, it was a nationwide study in Sweden, found that children with celiac disease were about 34% more likely than control children to develop an eating disorder. So there is an increased risk in this population. Within kids with celiac disease, being female, having a higher body mass index, having depression, and being an older adolescent are all associated with increased risk. So these are the populations that have the highest risk of disordered eating in celiac.
Oh, that's for the loyalty program. I don't need that.
So, you may be asking yourself, so when should we be concerned? Like what are some of the signs maybe to look out for that might indicate that somebody is struggling with disordered eating? I think a big one is if a child refuses to eat foods they used to like. And again, this is not like refusal based on, like, it turns out, the foods have gluten in them, but these are foods that are dietary, that they're appropriate in terms of the diet, and the kid used to like them and now they're not liking them anymore. And they're this, I would be particularly suspicious if they're higher calorie foods. So, a kid no longer wants to have dessert, no longer wants to have snack foods, things like that. If you hear a lot of sort of focus on things like, I want to eat healthy, or I want to eat clean, or low calorie, low fat, low sugar foods. There's a lot of garbage out there in the media about sort of how people should eat. And it's very easy to get sort of lured into whatever is the latest kind of dietary fad. And so you want to be mindful if you start hearing a lot of talk along those lines. On the other end of the spectrum, when thinking about loss of control, if you start noticing that large amounts of food are missing from the kitchen, or you find that someone is hiding food, or eating in secret, or even finding food wrappers under the bed, find a lot of food in somebody's room, other things like that. That would be an indicator that there might be something going on. If a child is making a lot of negative comments about their shape or weight, so I start saying, I'm so fat, or I hate, certain parts of my body, like my thighs or my stomach, that kind of thing, and really kind of talking about, I need to lose weight, I would be, somewhat suspicious of that something might be going on. If you notice unhealthy exercise, and so by that, exercise is great for people, but if your child's on a team sport and they're exercising more than their teammates, so they're going to practice and then they're coming home and spending another 2 hours exercising, that's a bit suspicious. Or they're exercising when they're sick or they're injured, or exercising in secret. So, finding out that a child is getting up very, very early in the morning in order to exercise, or hiding in their room to exercise, that kind of thing. And then in terms of physical signs, if you start noticing weight loss or weight stagnation in a growing child, we expect children to continue to gain weight, and so if a child starts to lose weight, or just stops gaining weight, that again could be a potential sign that disordered eating is emerging. So what are ways that people can cope with disordered eating thoughts and behaviors? So I think, one of the biggest or most effective interventions is to try to, reconnect with value domains outside of weight, shape, and eating. So, people with disordered eating and people with eating disorders often have a lot of their self-worth tied up in their ability to control their weight, shape, and eating, which is, problematic because A, these things are not entirely controllable, and B, you never want to have all your eggs in one basket, right? You want to have a lot of things that affect how you feel about yourself. And, on the one hand, it's probably unrealistic to have none of your self-worth tied up in appearance. I think most people have at least a little bit, but you don't want it to be, the only thing or the main thing. And so, ways of reconnecting might be to schedule activities with friends, take up new hobbies or practice old ones, volunteering, giving back to your community, doing things that give you a sense of self-worth that really don't have anything to do with weight, shape, or eating. For people who don't have issues with unhealthy exercise, engaging in healthy exercise actually can be a way to cope with this, because it's a way of celebrating what your body can do for you physically rather than focusing on what your body looks like. That lots of different body types can engage in healthy exercise, and being able to celebrate that. Another sort of key intervention that we use again for both disordered eating and eating disorders is to regulate your eating. And by that, we mean, eat roughly 3 meals and 2 to 3 snacks per day. Don't go more than 4 hours without eating, because that can both increase risk for restrictive eating, but also can actually increase risk for loss of control if people get too hungry. And know roughly what and when you plan to eat next. If somebody is having a lot of difficulty with disordered eating thoughts or urges, it can be hard. They have to sort of think on the spur of the moment about what to eat. So if you know roughly what you plan to eat next and when, that can make things a little bit easier. And then finally, have fun with food. So, we always encourage people to include what we call like fun foods in your daily diet, outside of things that you have to avoid for medical reasons. No food should be off limits in a daily diet, and you want to be able to have things that might be considered to be treats or fun. Exploring foods from around the world or new cuisines, and learning how to cook, making cooking fun. So there are a number of various sources of support for people who are, or families that are dealing with disordered eating. So, at the most basic level, there are some fantastic informational resources out there. The National Eating Disorders Association has a 24/7 helpline that people can call. They have an online screening tool that, again, if you're concerned that perhaps you or someone you care about might have disordered eating or an eating disorder, it's a great way to screen. They have a national treatment directory of people who have expertise in eating disorders. And I put up a picture of, they have a fantastic parent toolkit that explains everything from, what are some of the, in more detail, what are some of the signs to, how do you talk to a person, a child, or other family member that you might be concerned about. And so it really is an excellent toolkit. Another great resource is the Academy for Eating Disorders. This is the largest international professional association in the eating disorders field. They have a number of free webinars. They have an expert directory, again, if you're looking for help, publications and position papers on their website. And again, highlighted a really, I think, excellent one. It's called A Guide to Selecting Evidence-Based Psychological Therapies for Eating Disorders. There's a lot of treatment out there. Not all of it is evidence-based. And this is a great resource, if you don't kind of know what to look for, so that you can know kind of the questions that you'd want to ask. Another, really, I think, a wonderful resource for families is Feast, which is a supportive community. This is an international nonprofit organization of caregivers of loved ones with eating disorders. So it's caregiver run, caregiver support. They have a 24/7, what they call around the dinner table forum. This is where people can post questions, ask for support, and other people going through the same situation can kind of provide advice. It's moderated 24/7 to make sure that it's a supportive and appropriate community. They also have a number of free webinars, videos showing kind of different things that you can do. They have a Feast 30 days of Feast 30 days, which is basically 30 days that they send various informational resources and other guidance. They have a Facebook group. So it's a really, really nice, again, nonprofit resource for people who might be dealing with disordered eating. And then finally, if things get to a point where the disordered eating is transitioning more into an eating disorder, there are a variety of treatment options out there. One of the most important things to keep in mind is that outpatient treatment is the first line intervention. So I think people often are very afraid of this idea that, if somebody has an eating disorder, they're going to get locked up on an inpatient unit, and that's really not the first line standard of care. There is a treatment called family-based treatment that has the strongest evidence-based, and that's based on the philosophy that caregivers know best how to support their child, and it's an intervention where the clinicians are really supporting caregivers in helping their child to overcome an eating disorder. for families where maybe that intervention is not possible or not indicated, there also is an individual form of therapy, cognitive behavior therapy, or CBT, that also has an evidence base and is certainly another option. One thing to bear in mind is that we have a fair amount of research now that demonstrates that nutrition counseling alone is not sufficient to manage a disordered eating. So it can certainly be a component, but simply seeing a dietitian is not sufficient treatment. And then the other thing to keep in mind with outpatient treatment is it does require a multidisciplinary team. So at a minimum, you're going to have a therapist who's delivering the treatment and a primary care physician. If medications are involved, you may have a psychiatrist, and you may or may not have a dietitian. So I started that because, particularly family-based treatment is based on the idea that families know best, and that caregivers don't necessarily need a dietitian. However, sometimes that might be indicated, and particularly in kids with celiac, that might be indicated. Okay. Higher levels of care may be indicated for patients with medical complications or those who do not respond to outpatient treatment. Even here, we still go with the least restrictive setting possible. So you would want to start with something like an intensive outpatient program, which might be like 3 or 4 days per week, all outpatient. Then stepping up to a partial hospital program, which might be more like 5 or 6 days a week, residential treatment. And then at the highest level of care would be inpatient treatment, either in a medical setting or a mental health setting. And I think, the final thing that I want to leave people with is that recovery is very much possible, and early identification is associated with better outcomes. And I think there's a lot of sort of fear out in the general public population of eating disorders and disordered eating, and the idea that, that people, once they develop these disorders, they don't recover, and that's simply not true. The majority of people actually do recover, and the people who are most likely to recover are children and adolescents who are identified early and treated early. So, there is no reason to despair if disordered eating becomes an issue in a family. So that's what I have.
Thank you, Dr. Wilds. That was wonderful. We really appreciate all that information. Anybody that has questions regarding this topic, if you want to put them in the Q&A, and then we'll present them to Dr. Wilds, and maybe she can answer a couple of questions. I already do have a couple here. So the first one is a question about time-restricted eating. Latest research on that, thoughts on that, any input on time-restricted eating?
Yeah, that's a fantastic question. So I'm not a fan personally as an eating disorders provider. Certainly I don't love it for people with eating disorders. And I think they're, particularly in children and adolescents, I think my reservations about it are, these sorts of fads kind of come and go. And so right now this is the fad, but, I think that down the road, it may be something different. So, I think, as I said, the best way is to sort of roughly eat 3 meals, 2 to 3 snacks. Don't go more than 4 hours without eating.
Okay,
So
perfect.
Dr. Wilds, if I can just interrupt with one question. There's such a stigma, first of all, to celiac disease. So people, get diagnosed with celiac disease. Some people embrace it. Some people get the roll of the eye when they go out.
Yeah.
And then if they have disordered eating or some eating issue, which happens because that's all we're talking about, how would you say to this audience and myself, from a parent standpoint of children who have celiac disease, and how do you break that barrier? How do you break that stigma? This is something I think many times, even and from a physician standpoint, as a gastroenterologist, sometimes when I'm seeing somebody in the office, I'm like, there's this thing coming up. How do we approach it?
Yeah, no, that's an excellent question. I mean, I think part of it is that to say that it's very understandable, right, that disordered eating might develop in this population, that you have real medical reasons to avoid certain foods, that it would be understandable if somebody felt like afraid of certain foods. And these are unfortunately behaviors that can be associated, that can lead to the development of eating disorders. And so, in some ways it's really quite unfair, right? You already have this condition, celiac disease, that now it's not your fault, and now it's like setting you up, and essentially you have to engage in behaviors that increase risk for eating disorders. So, I think that's part is really validating that this is not, that things like food avoidance are not a choice. And I think, and just in general, when I'm talking either to people who have eating disorders or their families, I really do emphasize, like, nobody chooses to develop disordered eating or an eating disorder, and most people actually do engage in some of these behaviors and nothing ever happens with it, right? And so, nobody would choose to have one of these illnesses. They're real illnesses, just like any other illness, and they're treatable.
I think that's a fantastic statement that you've made, that no one chooses to have this. I'm going to use that because that is one of those feelings. It's like no one chooses to have celiac disease, and no one chooses similar to have other diseases. And this is another disease that's out there that perhaps we all need to talk about and get the correct treatment there. And there's a question in the chat which brings to the sibling. So, we often forget about siblings when we're talking about celiac disease. So I think the question in the chat from someone is about their sibling of the non-celiac sibling of the children. How often, how commonly do you see that in any other chronic disease, or talk about celiac? Very interesting question there.
Yeah, that is a good question. I feel like in our clinic, actually not that common. Like, it's more likely to see the kid with the chronic disease and also has like the disordered eating than to see the sibling. I mean, sometimes, but I don't, just in my anecdotal experience, I can't think of that as being like something that stands out as being like a common thing we see in our clinic.
Is that something because we don't talk about it either? It might be that the problem is bigger than what we think. So again, we kind of not talk about the rest of the family. We talk about the person who actually has the disease or whatever it is, and we're focused so much on that, just like I did with my family, just focused on those two who had the disease. So yeah, I guess that would be something that we would need to work on. But Lindsay, I'm going to hang it back to you.
Sure. Another question that we have is, how do you treat people with celiac disease different than general population whenever you're working with them?
Yeah, I mean, I think that the big thing is, of course, you have to loop in the celiac team, right? Like, this definitely has to be a joint effort. Probably the medical monitoring would be more likely to be done by like the gastroenterologist or other people on the team than whereas we would typically have like an adolescent medicine physician or a general pediatrician. You're probably more likely to have a dietitian involved. So again, this first line intervention for children and adolescents, family-based treatment, is really based on this idea that parents or caregivers know best. And so, you didn't need a dietitian to help you feed your child before their eating disorder. You don't need a dietitian to help you feed your child now. Well, if you have a chronic disease like celiac, well, a dietitian may well be a necessary part of the team, with essentially providing guidance on how to either refeed or re-nourish a starving child, or how to help a child decrease loss of control over eating while also adhering to a celiac appropriate diet. And so I think that would probably be one of the biggest differences. But outside of that, I actually think it would be pretty much the same.
Great. I think we'll do one more question, and that is, what's the best way to approach an individual with an eating disorder that maybe isn't accepting it, or at least maybe somebody you think might have one? How do you approach that?
Yeah, that's really, really tough. I mean, I will say, you know, for people who are dealing with that, the parent toolkit from Nita has some great kind of lines and actually like language to use. But you know, I think the key is again to focus, you know, the sort of I statements like I'm concerned. I would focus on like behaviors, like, you know, I have noticed that you're leaving a lot of food on your plate, or, you know, I've noticed that you've been spending a lot of time, you know, looking at yourself in the mirror or pinching, you know, certain parts of your body, you know, that to really focus as opposed to saying things like, you know, like you aren't eating, or, you know, I found uh, or you seem unhappy with your body. I would really focus on what you yourself have observed, and kind of leave that open, and ultimately express concern. Like, I'm concerned, I'm worried about you, I care about you, I want to help you. It doesn't necessarily mean it will be well received, but that's sort of the most likely to be effective.
So I have a question for you, Dr. Wells. It's part of in the chat as well, but I'm very interested and I'm going to add a twist to this question. So the question is, do you have any techniques for encouraging your child to eat a healthier balance, like eating more vegetables and fruits? And I want to know, how do you do that for a 25-year-old? My 25-year-old with celiac does not like to eat fruits and vegetables. Well, he has some fruits now, but are there techniques for or suggestions that you have for parents who are going through not only trying to keep them gluten-free, but also want a healthier diet?
So I'm laughing because I famously tell my clinicians my daughter frequently is like eating cookies for breakfast. So clearly, at least as a parent, no, I don't. I think, you know, evidence basis, you know, to, you know, continue sort of offering, you know, you need to, like, I think, try something like 30 times in order to like develop a taste for it. So, you know, have it out. But you know, I will, one of my daughter's some more famous lines when I tried to do this was like, Mom, do you want me to have an eating disorder like your patients? So, you know, I don't know that that always works, but I think, you know, having the food available, you know, obviously modeling the food, eating the food, but at the end of the day, I fear I don't have any great techniques either.
But, you know, I think that's important for us as parents to keep that in mind, that what's important, there is the physical health and then there's a mental health. So do you really sit down and struggle all the time and make sure you get your 5 veggies and 5 fruits in? Or do you say, okay, you know what, you got some in, let's move on. We'll work on this all the time. And I will not, I'll tell you one story about my son. I sat with him and my daughter will be laughing behind the screen, but at that time he was about 7 or 8. And no fruits, no vegetables. The pizza, it was all carbs. And I sat at the table one day and I said to him, we're not moving from this table till you eat this fruit or vegetable. And we sat for a long time till my husband had to tell me, get off, this is not worth it. Poor kid was crying. So I think that we all struggle through it, but we all have to think about that mental health of that child as well, besides the physical health.
Yeah, and you know what I will sometimes tell people, like when they're concerned about this, is that, like, you know, not always, but people often do expand their palates as they age. And so, you know, just because your child, you know, I think about all the things that I didn't want to eat when I was, you know, a child or an adolescent that I eat now or even like now. And so, you know, it doesn't necessarily mean that they're going to be, you know, malnourished for life or things like that. And so, yeah, I life is too short to haggle over these things too much.
Agreed, agreed. Thank you so much, though. Thank you.
Thank you.
Thank you, Dr. Wild. That was very helpful. Lots of great information. I think at this point, we're going to take about a 5-minute little break, and everybody can refill their coffees and have a little stretch, and then we'll come back in just about 5 minutes.
Hi, everyone. We are going to jump back in. I hope everyone got a minute to themselves, refresh your drinks. And we have such a full day. Again, for those of you who joined a little late, I'm Rachel Lieberman. I'm the director here at the Celiac Disease Center. We are so happy to have you as part of our Family Education Day. Few housekeeping notes. I just want to remind everyone, please utilize that Q&A function at the bottom of your screen. It really helps us keep on task with our speakers. We really want to get to all of your questions. We are so happy. We've had a wonderful morning with Dr. Ritu Verma and Dr. Priyanka Chu, her daughter, giving us great advice and on clinical presentations and family coping and our follow-up. And we just had a really powerful presentation from Dr. Jennifer Wilds on the topic of disordered eating. I want to remind you all, we are recording today. We'll be posting these videos up on our YouTube, and Lindsay, our educational coordinator, Lindsay Yackel, who's put together this fabulous day, will be sending information on how to join in. I'm so excited to move to the next section of today, which is what we are calling our emotional part of really honing in and talking to fantastic people who have taken their diagnosis of celiac disease and really utilized creative ways of making the best of embracing their disease, empowering themselves. And so we have a dynamo group coming up. We have Erin Smith of the Gluten-Free Globetrotter. And I'm sure a lot of you are familiar with her. We have Kim Thomas of Let Them Eat Gluten-Free Cake on YouTube. We have Michael Frolickstein and Cameron Weiner of the Celiac Project podcast, who we also have a program with them. Next week, we have Shane Goldberg, our author of From Surviving to Thriving, who has a really powerful story to share, and Chloe Goldberg, who is our chef extraordinaire and really came up with her own catering business. I'll let Lindsay moderate, but I am so excited to hear from this panel and how everybody has really embraced their celiac disease and empowered one another. So Lindsay, I'm going to turn it over to you, but I am so excited for this session.
Thank you. Thanks for introducing everybody. If all of those people that we mentioned could maybe, turn on your microphones and cameras on and all of that, so that we can have a little bit of a conversation here, that would be great. So basically, this is a group of people that all have celiac disease. They've been diagnosed for a number of years, and they range in age from children through adults. And they've done some interesting and fun things to kind of cope with their diagnosis. As we discussed with the disordered eating portion of this, it's always great to have other coping mechanisms. Dr. Wilds listed some options. These people have done some things. So we kind of want to hear their stories and how it all came to be. So we're going to start by talking about maybe their diagnosis stories, and we'll sort of work our way through the group and hear a little bit from them. So maybe Erin, if you want to kick us off with a little bit about your diagnosis story and how this all started for you.
Sure. I am Erin Smith. Thank you for having me here today. I was actually diagnosed way back in 1981. So I don't really remember life with gluten because it's been my entire life. And I've been blogging since 2007. I've been running support groups in New York City since 2005. And really, celiac is my, it's such a passion of mine because I didn't know anyone growing up. So I'm actually really excited to hear Shane and Chloe speak, because I was probably their age when I met my first other fellow celiac. So I'm not going to talk too much now because I am speaking more later. So I kind of pass it on to the next speaker.
Yeah, that's great. Yes, Erin will be speaking again later in the program related to traveling with celiac disease. She has lots of information to give us later about that. So yeah, if maybe Kim, if you want to give us a little bit of your diagnosis story, that would be great.
Sure. If I actually can pass mine to Mike, he has the intro and I jump in a little bit later.
Perfect.
Yeah.
Thank you, Cam. So it's so great to be here today. And this is really, I guess I wanted to start just by saying, so I was diagnosed at 40, and today is like a full circle moment for me, and I'll tell you why. I'm going to just talk about how I don't feel I was diagnosed at 40. I'm a filmmaker, and I don't feel like I chose to start the Celiac Project. I feel like it was sort of put upon me to do. Like, I knew within 2 weeks of my diagnosis at 40, I had been sick my whole life, and I knew I wanted to do something to advocate and raise awareness. And why this is today is a full circle moment is that I think, I've never had some project in my life that I felt a calling, like I felt I need to do this. And so started making the film, and it's just, this today is just wild because got the opportunity to go to the East Coast, and I had a short list of people that I wanted in the film, and Aaron was one of them. Priyanka was one of them. And so I had this list, and I called people up, and unfortunately Aaron was in Costa Rica at the time, so couldn't get in this iteration of the documentary because Celiac Project started as a documentary, if I didn't explain, and turned into a podcast. So I was able to go to New Jersey, and I knew Priyanka before she became a doctor. She was blogging as Anti-Wheat Girl. Didn't really know that much about her besides she was a real advocate for our community. So I had reached out to her, and the day that I was to interview her, she said, well, I'm sorry, I have this like support meeting group that we do around celiac. Is it okay if you interview me there? And I said, sure, that sounds actually even better. And then she said, and my mom sort of helps run this group, and she's this gastroenterologist. Little did I know that her mom was one of the preeminent, Dr. Ritu Verma. So I should have done more of my research, but was able to sit down with them. And literally when I was driving out of New Jersey, I was like, I didn't know if anybody would want to watch a documentary on celiac disease, but I was like, this is sort of the magic of this. I didn't make this happen. This is just coming together. So sorry to be long-winded about that. To bring Cam into it, more magic when we finally had a screening in my hometown. He was a young man who had just gotten diagnosed, saw the documentary, and we just talked for hours and said, we have to continue what I started with the documentary. So we started the podcast, and I know we have a short amount of time, so I will, if you want to learn more about us too, thank you. As Lindsay said, on Monday, we'll have another event. So yeah, I'll let others talk.
No, that's great. Perfect. Okay, so what about, let's hear from Kim Thomas. Kim, are you there?
I'm sure we can come back to Kim.
Yeah, we can do that.
So we can just move on. And
Sure,
Kim,
sure.
did you want to say something as well? Or Mike, are you going to be tag teaming later, or what are we doing?
I could just add real quick to the podcast part of the story, or at least my diagnosis part of the story. I was living in California at the time and was just starting an early career for myself, and got too sick where I wasn't able to continue work and living on my own in California. So that's when I moved back home to get family support. And then, like Michael said, his documentary was screening at the local library. And after watching that, it was extremely moving and meaningful. And like he said, we had hours and hours of conversation. I was already a big podcast head. So I was like, I don't believe there's anything like this out here yet, so maybe we should fill the space, and the rest of it's kind of history. So, and it's been, and I have to also agree with Michael. I didn't pick this journey, but the journey seems to have picked me, and I couldn't imagine having a group of experts and people in support like we have today all the way back then. So it's pretty amazing to see the evolution of it all. And I just want to thank everyone for being here today too.
And it's so funny. I mean, that's how we all get together and support each other. So that's the community. I never knew that Mike was coming down. He knew Priyanka, and it was, we were just having a support group at that time in our Voorhees office. And Priyanka's like, oh, will you talk to him? Like, yeah, sure, why not? And I think that's what most of us do is we just, why not? Let's talk kind of thing to help each other. But Mike and you have done obviously a fantastic job in terms of for the community itself. And yes, definitely tune in on Monday.
Yes. It is amazing that the celiac community seems to be so small because everybody is so connected and kind of know each other and all of that. So it's such a nice community to be involved in. Okay, what about Chloe? Chloe, do you want to tell us a little bit about your story?
Yeah, sure. I'm Chloe. I'm 16 years old. I got diagnosed when I was 5 years old after my mom got diagnosed. They tested me and my brother, and it turns out that I have celiac. So I've been gluten-free for my whole life. And it's been a journey. And one of the ways I've coped with it is I have I tried to not avoid any kind of food that I wanted. So if I wanted something and I couldn't find it gluten-free, I'd make it gluten-free. And I think that's really helped me cope with my celiac disease.
Great. Chloe started a little bit of a catering business a couple of years ago, and I know she had a lot of fun doing that. So that's a great thing. And Shane, do you want to tell us a little bit about your story?
Yes, so I was diagnosed in 2017. Some members of my family had just been diagnosed, so the whole family had decided to test. And my diagnosed journey took about a year. It was a lot of back and forth and multiple different tests. But we eventually concluded that I had celiac disease. And I think my book had really helped me cope. Just helping others with it too is something also that I'm really passionate about.
Yes, Shane wrote a book.
Yes, I'm like, Lindsay, let's not Shane be so modest.
No,
Shane's
no.
book is amazing. And I had the pleasure of working with Shane a little bit, and I know Dr. Verma has. And what I think is so powerful, Shane, is you started this, am I right, as a bar mitzvah project, right?
Yes.
And what is so cool is that people who have seen your story, it really impacts them. And I think it creates this, a lot of, for our teens, Lindsay helps us run all of our, in transit and family network. And we're always trying to meet everyone who's dealing with celiac where they are. And what I love about your book, Shane, is you really talk about your story and, how you coped through things and adjusted. And I just think it's an amazing book. It's special, and you did a beautiful job. So.
And I guess, Shane, you could tell us, how can people get that book besides from the Celiac Center here?
Well, we're working in different ways now to help get it out more onto the internet so people can access it quicker. And yeah, I think it's definitely a good read, and people should definitely pursue it, especially people who are newly diagnosed, because I feel it gives you a wider variety of different questions and answers that you are looking for.
Actually, what I would love, Shane, is if you would read a little excerpt from your book for us. And this really falls right into this whole coping area that we're sort of talking about. It's a nice little excerpt if you'd read it.
Yeah, so I'm going to read a part from my adjustment section in my book. When you first get diagnosed, you might feel overwhelmed, confused, embarrassed, nervous, and most of all scared. This is 100% normal. Not everyone knows what you can and can't eat. Many people are there to help you, including your family, doctors, and friends. My advice for people going through this is to hang in there. It may feel like you are at a low point, but some of these feelings are only temporary. Even though there will be setbacks and hardships along the way, it will get better. When I was going through this, I tried to not think about it too much and think to myself that there's more to life than just food.
Wonderful. Wonderful. Such a great book. Really encouraging and uplifting. And we think it's great. Thank you so much, Shane.
And very well said. There's more to life than food, right?
Yes.
That's for
Thank
sure.
you,
That's
Shane.
for sure. And I think that's what everybody in this group has basically found, that there's other ways to cope, other things to do and think about and participate in, and a lot of opportunities out there to enjoy life without all of your focus being on celiac disease. And that's what coping is all about. So that's our group for this panel, how they, were diagnosed, what they're doing now. So yeah, I appreciate all of you being here. And again, Mike and Cam will be doing on Monday at 6:30 Central. We will be having a conversation with them. It's geared toward men, and it doesn't have to just be the men that come, though. The women who have men in their life, please join as well. Anyhow, so we'll be talking to them a little bit more in detail on Monday. So we're looking forward to that. Thank you, Shane. Thank you,
There's a
Chloe.
question. Sorry for interruption. There's a
No.
question for Shane. What's the name of your book in the Q&A?
My name of my book is From Surviving to Thriving.
Perfect. Thank you. Okay, so the next thing that we're going to do is I am going to talk about some resources, support groups, things like that, that also are helpful with coping. Again, we're still on that topic, and that's kind of a focus at this point. So support groups are a great resource for people who have celiac disease. There's lots of different support groups. Here at the University of Chicago, we offer something called Family Network. That is for those who have celiac disease as well as their families. They're all welcome. There's education involved. There is that sense of support and community and those kind of things that are very helpful. So we have Family Network. We also offer a program called In Transit that is specifically for the teen group, and we offer that once a month, except over the summer, and that's just an opportunity for the teens to come together and discuss how things are affecting their lives and all of those kind of things. So we look forward to those. And the teens, you never know what kind of a topic you'll get into with them, which is very fun and keeps us entertained, that's for sure. And so then there's other national support groups that are more at a level of across the country. Some of them even are in other countries. I know Gluten Intolerance Group, they have a support group, and that's an international support group. So there's lots of those around. There's another one called ROCK, which is Raising Our Celiac Kids. That's around the country as well. And National Celiac Association, they have support groups. There's also things that you can do, like if you go on meetup.com, you can look up support groups that might be in your area if some of the others aren't around. There might be smaller groups of people locally that get together. Sometimes they just get together to go out for a gluten-free meal, or, it's an actual support group, but you can find it on meetup.com. You can also find support groups oftentimes on Facebook. And just know that a lot of times those are not run by one of the national groups or a university like we're dealing with, a celiac center. A lot of times those are just people like you who are running those. And so information can be helpful, but sometimes not always completely accurate. So, but they're out there. We also have social media. You can always find information on blogs and Instagram, Facebook, things like that. TikTok has information for the kids that other kids are putting out there. We as a center have all of our social media with lots of educational resources on that we put out there. We're on most of the social media outlets. So that's another way to get resources and information. I know as far as other resources go, there's Celiac Disease Foundation. They have a lot of information on their website, put a lot out, do a lot of research, things like that. Beyond Celiac is another one. They have lots of resources on their website. And then there's apps like Find Me Gluten Free. It's a great resource for finding a place to eat. If you're traveling, it's a nice way to look up places that you can eat. If you haven't used it before, I definitely suggest it. It's Find Me Gluten Free, and it's all about restaurants. And I do believe there's some information on there about universities now. That's a new area that they've started to fill in and get some information on where you can eat at universities, how the universities are feeding kids, things like that. So lots of good information there. We at the University of Chicago also offer a mentorship program. Currently, at this phase, it is only for University of Chicago patients as mentors and the mentees. So you have to be a patient within our center to be involved, but who knows, if that goes well, we just may end up growing it. So right now there's a mentorship program. I think that there might be other mentorship programs out there for celiac as well. So yeah, those are the things that are the resources and things that we wanted to share. And from here, actually, Rachel, if you want to introduce the next.
Absolutely. Well, first of all, thank you so much, Lindsay. As everyone knows, there are so many resources, and I obviously highly, recommend we have some of our resident bloggers here, which Priyanka and some other people, which are wonderful resources. And we at University of Chicago always just talk about, credible sources, and we hope to be one and a resource for all of you. And as Lindsay mentioned, all of our educational programs, please, we want you to be involved. We love ideas. I get very animated and excited about it because we're constantly growing and changing, just like the celiac community. So now we are moving into our program.
I want to make a plug.
Yes.
My plug is for the in-transit. I know I've done this before, and I'm going to do it again. If you thought Rachel was animated, you're going to watch me getting animated about the in-transit. I honestly believe that the future of celiac disease is with the young people. It's your disease. It's what you have to deal with. You have to set the stage on how you want research to go, how you want advocacy to go. You want to get involved in that. None of us, I'll talk for myself, none of us old people are going to know what you are going to feel. So in order to have your voice heard, please, please, please join the advocacy groups, join our in-transit group. And there's a question in the chat about how do you join? We'll let you know. Join. The children need to join. The children need to learn and take the baton on and move on to the next thing. So please join us. We want it to be exciting. It is going to be exciting. It is exciting. Join and we'll make it even better, or you will make it even better. That's my plug. Join. Rachel, back to you.
This has been Dr. Verma's. It's been a pleasure growing this program with Dr. Verma. And now that Lindsay is on board, and we actually have, I want to shout out to Audrey Rowan, who is one of our dietitians, part of our team here at Comer Children's, part of our celiac team, and Rebecca Auburn, our amazing intern who's been with us for 2.5 years on a lot of social media things. But it takes a village, but it takes all of you. And for us to grow these programs and meet the needs of our kids, we are so excited to partner with you. And as you can see, we're always like, yeah, let's try it. Let's do it. And so I hope that you'll join us as we continue to grow. But I'm really excited about this next section of our talks today. We are going to talk all things travel. And I know for me personally, it's some of my favorite TikToks are travelers who have celiac disease. I watch them incessantly, but I think they're amazing. Just watching how people navigate different places and travel. But I am so excited to welcome back Erin Smith, who is our gluten-free travel blogger. I think she will lend such great insight. We're excited to hear from you. And Maureen, I don't want to butcher your last name. I apologize. But Maureen is here. She is the founder of Celiac Cruise, and she is going to talk about her story. And I know our own Dr. Verma will be on a celiac cruise very soon. So I'm excited to hear about all of these things. So ladies, if you want to take yourselves off and Maureen, I'd love to give it a shot of, is it Basie?
It's
Basie?
Basie or Basie. I mean,
Okay.
it's
I was-
it's many
I was
different ways.
close.
so.
I apologize. I just,
No.
I'm
Okay.
so happy to have you and Aaron. So I'm going to let you two take it away from here. And if you want to, actually, Maureen, since you're on right now, or Lindsay, I'm sorry if I'm messing this up.
No, that's all right. No, Aaron's scheduled to speak first. So
Okay,
we'll
perfect.
let her go.
Okay, perfect.
Okay. Lindsay, it says that I can't share my screen, so.
Oh, let me see. Should let you now.
Okay, got it. I will. And you can see the whole thing now. Hi, everyone. I know we met a few minutes ago. I am Erin Smith. I'm going to cover traveling with celiac disease. My website is called Gluten Free Globetrotter. So some of you might be familiar with it already. But I'm going to go through pretty quickly today. Feel free to message me on the side if I go too fast, but this is the quick agenda here. And I like to start with an introduction. And like I mentioned before, I was actually diagnosed with celiac in 1981. I also have a shellfish allergy and a kiwi allergy and a son with a peanut allergy. So traveling for us is a little complicated, but we manage. I started my website, Gluten Free Globetrotter, in 2011, basically because all of my travel has been 100% gluten-free. I've been to 38 states, 24 countries, 3 continents, and I've driven cross-country twice, all with celiac disease. I also have a sister with celiac disease, and we have 2 other first-degree relatives with celiac disease. So it really is a big part of my family. I wanted to echo what everyone was saying earlier. Support is so important. I've been running support groups since 2005. The support group I joined when I was a teenager was really my lifeline. I didn't know anyone else. So I highly recommend the in-transit group that Dr. Verma mentioned, but really anywhere you can connect with others with celiac is so important. So I'm going to dive right into where to go. That's the #1 question I get through my website or my Instagram. And really, my top recommendation is large cities. I am biased because I live in New York City, but New York City actually has more than 35 dedicated gluten-free restaurants and bakeries now. So we really are kind of like this special place in the world that we have so many options. I know that's not the case everywhere you go. I've been there going hungry, but also I find that because we have a celiac disease center here, because of Chicago, where you are based, and also in San Francisco, not too far from a big celiac center in Palo Alto. I find these larger cities tend to be more gluten-free friendly. It's not always the case, but there are a lot of advocates living in these cities, and I find that the bigger the city and the bigger the food scene, the better you are, the more likely you are to find gluten-free places to eat. But also cities that are food-centric. Portland, Oregon is a wonderful place. If you haven't been there yet, add Portland to your list. I worked there for many years, and there really is a great food scene, but also a great gluten-free food scene. Same with Austin, Texas, and then Disney. I know a lot of readers of mine are very big fans of Disney because Disney is very accommodating when it comes to gluten-free. So if you don't have a destination in mind, I don't think it's a problem. I'm gonna talk about the celiac, I'm gonna let Maureen talk about the celiac cruise, but really the celiac cruise is a fantastic kind of worry-free vacation. The other thing I like to tell people is that there are gluten-free hotels, bed and breakfasts. In California is the Inn on Randolph. It's 100% gluten-free. Closer to me on the East Coast is the Inn Berlin, also 100% gluten-free and run by an innkeeper who has celiac disease. So these places exist. I did a little more research into your neck of the woods and near Chicago. Irish Hollow is a gluten-free bed and breakfast that can cater to people with celiac disease. So my point of this slide is to tell you that these places exist. I think people don't realize that gluten-free bed and breakfasts are a thing. So you can do your research. You can send me an email. I'm happy to help you do your research on where to eat as well. Also, there are celiac tour guides, celiac travel agents, people living with celiac disease that help other people book their travel. I might actually work with a celiac travel agent later this year. But again, these resources are out there. You just have to do a little bit of research, get familiar with, you know, where you're going, and there might be a person living there. Or on the flip side, there are places like Florence, Italy, that there's a woman named Catalin. She has celiacinitaly.com, and she does tours of Florence, Italy, and she's a great resource. So these resources are out there. Also Airbnb, VRBO with a kitchen. I'm going to talk about that a little bit more later. So my number one tip is to do your research before you travel. The worst thing to do is to get on your vacation and then be completely stressed out about where to eat. So start doing your research before you travel. And how to do that research, go on gluten-free blogs, my blog, Gluten-Free Globetrotter, or there's a number of gluten-free bloggers out there that are specifically talking about travel. So reading blogs, connecting with gluten-free locals, either through local support groups or social media. These are great tools. Without a doubt, there's someone living with celiac disease in the city that you're traveling to. So I highly recommend getting on social media and just finding those resources. Whenever I'm going to a new city, I type in gluten-free and the city that I'm going to. Most recently, I went to Charleston, and there were like at least 2 or 3 local bloggers that were just writing about gluten-free places to eat in Charleston. So I kind of compiled a list. I also put it out there on my Instagram. Hey, has anyone been to Charleston before? And I got a ton of recommendations. So kind of start doing my research at least a month ahead of time. And so I make a list of restaurants, I make a list of local cuisine. The other thing I will suggest when you are traveling internationally is get familiar with the local cuisine. There are, you might have to use Google Translate, but it's helpful to know what the primary dishes are. Now, as someone with celiac and a shellfish allergy, if I'm going to a city or a country that is very, seafood heavy, I try to really do my research ahead of time to make sure that, obviously I could eat chicken and meat, but also if there are a lot of shellfish-based dishes in the city or country I'm going to, I want to be aware of that ahead of time. I don't want to be surprised when I get to those countries or cities. And then I'm going to go to digital map and talk about this a little bit, but sorry. The map is something I always build for every city I'm going to. So what you see on your screen now is a map of Philadelphia from a trip I took in 2021. I have been there many times over the past 10, 15 years. And Philly has a great gluten-free small scene, but a great gluten-free scene. And I basically build a map. You can use Google Maps very easily. Not only do I include where I'm staying and some sites that I want to see, but I include restaurants, dedicated gluten-free or gluten-free friendly restaurants. I include restaurants that I know have gluten-free menus that I may have contacted ahead of time. I also include hospitals or urgent care. Unfortunately, I've had to go to urgent care in other cities and countries before, but never related to celiac. It's always been something else, whether it's the flu or food poisoning. But I think having this map built out ahead of time is very helpful for when you're traveling, and it's free on Google Maps. So again, continuing on the research, just mentioned earlier, some gluten-free apps like Find Me Gluten Free. I also use TripAdvisor and I use Yelp. I always try to look at menus ahead of time. Now, this isn't to say I plan every single meal for my trips, but I do like to have a good sense of what is available in the city I'm traveling to. Now, I will say for any website you are using, don't rely just on one website. For some of the gluten-free apps, some of the reviews are really outdated or restaurants are closed. When I was traveling cross country, I drove out of my way to go to a restaurant that was no longer open, and I just failed to look at the date of the reviews on the app. So it's important to like use a number of tools and not rely on just one. The other thing I will say is don't assume that your favorite chain restaurant from your hometown is safe in another city. I know there's some very popular chains that you could find across the whole country. I've had good experiences, I've had bad experiences. It really depends on the chain and the franchise itself. You know, just don't let your guard down. You're on vacation. The worst thing that could happen is, you know, getting yourself sick on your trips. It's happened to me. It's happened to the best of us, but really just be careful and do your research, make that list ahead of time, eat at non-peak times. And I even do this here in New York. Eating at non-peak times is a great way to kind of get a little bit more attention from the people in the restaurant, being able to speak to a chef or a manager. And I hate to say this, but you know, better safe than sorry. When in doubt, leave it out. If you are questioning the food that they are giving you, or you think they, you know, took your salad and just picked the croutons off, like it's better to not eat an unsafe meal than to risk getting sick, especially if you're very far from home. You don't want to be sick on your trips. So, oops, sorry, I skipped ahead a little bit. Another thing to do with planning is printing or purchasing celiac cards. We'll talk about those a little bit. Always packing your food. I'm sure that everyone here always has, you know, snacks in their bag, snacks in their backpack, but making sure to pack that gluten-free food in your carry-on rather than checking your bags. Also, same with medication and a doctor's note, which I'll show you an example of. And then we talked about the apps. Something I also do is use online reservation tools such as OpenTable or Resy to make a reservation, but also in your reservation, you have a bio and you can include your dietary restrictions in your biography or your profile on the app. And that's a really great way to start that conversation before you've even left for your trip. So most recently, when I went to Charleston, I made dinner reservations using an app. And when I arrived at the restaurant, they not only knew I had celiac and a shellfish allergy, but they printed out a menu for me that highlighted what I could and could not eat. And this was just like so reassuring to me. It also was my birthday and they wrote happy birthday across the top of the menu, but it was just such a nice and easy way for me to communicate with the restaurant and them to share with me what I was, you know, what I could eat safely. And again, check multiple resources. So this is a doctor's note. I'm not going to get that into it now because I want to be mindful of time, but I have used the doctor's note when traveling. And basically, I've never really had a TSA agent stop and read it because they're so busy. But I brought it when I was going to Singapore for the first time. And I was just really nervous because I had 24 hours of travel ahead of me and a ton of food in my backpack. I didn't want anything to be confiscated. TSA just waved me through. I mean, they didn't even stop me. So I do have this example on my website if you want to look at it and maybe, you know, discuss it with someone like Dr. Verma, but it is a tool that I've used in the past. And then food, you know, we don't need to get into exactly what I pack, but I pack a lot of food. This was my carry-on for Singapore specifically, because I had so much time ahead of me. I've since changed how I travel. You'll see peanuts in here. I don't bring peanuts now because my son has a peanut allergy. I actually try not to bring any nuts at all when I'm traveling, just to be mindful of the travelers who are around me on the airplane. Also at the very bottom, I have what I call stinky foods, the hard-boiled eggs, tuna pouches, and turkey or beef jerky. You might not want to eat that on the airplane. It's not so pleasant to be surrounded by people eating hard-boiled eggs, but at the same time, I want to really emphasize bringing protein with you and not just snacks. And then translation cards. And again, I have links on my website, and I believe that Lindsay's going to send out some of my notes after this event, but I use translation cards. These are a great resource for you know, having that tool with you that explains in foreign languages what you can and cannot eat. So we're going to talk really quickly about when you are in a rental kitchen, and I like to call it a BYO kitchen, bring your own kitchen. So basically, if you are going to like a summer house or you are visiting with family, I like to pack a few things, and this doesn't have to be a huge, you know, box of tools, but just tools that you can use when you're in a shared kitchen and you're not in your own home. So toaster bags, I know when I talk about toaster bags, a lot of people have never heard of these. You can even buy them in the supermarket now, but toaster bags are just a little reusable bag that you can put your own gluten-free bread in and then use a shared toaster. It makes this barrier between your bread and the shared toaster. Collapsible bowls, new sponges. So these are just some things that I pack with me when I am going to a kitchen that has otherwise had gluten in it. My kitchen is about 95% gluten-free in my own home, but I have traveled to Airbnbs before that clearly have gluten residue, and but I like to bring a few tools with me just to keep my food safe when I'm using a shared kitchen. And again, this is also on my website. Everything is free. You can download this little checklist I have. I know some of the listeners here have contacted me about this list before, so it's on my website. And then eating on the go. I mean, I said this earlier, but I really want to emphasize, don't assume your favorite restaurant from home has the same protocols in another city. I know when people come to New York, they often want to eat at a chain restaurant, maybe in Times Square. I really push people to not do that because these restaurants are so busy, the turnover of staff is so high, and there's no guarantee that this chain restaurant in Times Square is the same as like a chain restaurant in Chicago. So just be sure to, you know, to ask the questions, check local reviews, do the same, you know, kind of level of due diligence that you would if you were going out to a new restaurant in your hometown, and ask about ingredients lists. One thing I will say in Europe is that there's a requirement by law to have a binder of ingredients at restaurants. So I wish that the United States was at that level. We aren't there yet, but a lot of restaurants do have ingredients lists, and they will be forthcoming with that information. But also one thing to keep in mind is that familiar food here may not be the same in a foreign country. So, you know, there may be packaged goods here that have a different formulation overseas. So just be sure to read the ingredients. In Europe, also, you have to have the food labels in multiple languages. So I know people ask me a lot, like, how am I going to know what's on the label in Spain? And it's like, it's actually a requirement with the EU that you have to have English, Spanish, French, multiple languages on those packages. Really quick, I like to talk about thinking outside of the restaurant box. And I've done this many times, especially when driving cross country and I was unsure of where to eat. Local and chain supermarkets, pharmacies, big box stores, many Walmarts and Targets now have supermarkets inside. So you can build a meal from going to the supermarket, going to even a gas station or convenience store. I'm going to show you a picture of a gas station meal. And I call this a gas station meal because these are all things that I got at a rest stop. I got fresh fruit, I got gluten-free turkey, jerky, and chips, and then again, peanut butter and banana chips. But this is not a meal in like a restaurant, but this is the meal that kept me going on, you know, a 14-hour driving day coming from California to New York. So, and you could do this at 7-Eleven, you could do this at in the East Coast, we have Wawa, but like these are places that you can build a meal if you are hungry, and you don't have to rely on the restaurant. Another thing I've done is buying the pre-made salads in a supermarket, buying a package of gluten-free deli meat, and then building kind of my own chef salad on the go when I'm hungry. So, you know, again, don't despair. If you don't find a safe chain restaurant, you can also find a supermarket pretty easily. And then just some bonus tips and tricks, just before I pass this over to Maureen, one thing I always do when I'm traveling, I make my sandwiches on frozen bread, but then I also freeze grapes. And the reason I use grapes is because sometimes TSA will pull out your ice packs and say it's liquid, or it will be liquid, or, you know, so the grapes are cold and then you can eat them. But also the frozen bread just keeps, you know, your sandwich cold a little bit longer. Always bring bags with you. I unfortunately went to Thailand for 2 weeks, and by day 3, my bread was in like totally infested with ants. So I had to throw away all my bread. But I, you know, use the bags for everything from shampoos to your food. And then also you can ship food before you go. There are many online ordering tools now that can actually, you know, ship your food to the hotel that you're even staying at, and the package will be there when you arrive. And then get creative with hotel room cooking. If you follow Priyanka, Anti-Weak Girl, on social media, she heated up a sandwich with a hotel iron last week, and I thought this was genius. But her food was in foil. She heated it with the iron. But that's what I mean by cooking. Like, you can heat water in the coffee maker if it's not a Keurig. You know, there are other things you can do in the hotel to get creative with cooking. So I would love to hear if you have other hotel cooking tips, but Priyanka, that was a great tip. And then just like to show where I've been. Like I said earlier, I've been to multiple countries. These are from gluten-free from around the whole world. But I also encourage you to share your pictures with others, because you might inspire someone to go, even if it's from, you know, Chicago to Madison, or, you know, a local trip. Like, please share with others so they can experience, you know, have these food experiences as well. And this is how you can reach me. I'm not going to do Q&A now. I'm going to wait until Maureen is done. But thank you. And I hope that, you know, if you have any gluten-free travel questions, please email me anytime. I'm happy to connect with you.
Awesome. Thank you, Erin. Erin has been one of those people in this community that from the very beginning, I was just so happy to get to know, because she has so much information. All right, so I'm going to share my screen here. Okay, I'll close the chat. We don't need to see that. All right, everybody. So obviously my name is Maureen Basie. I'm going to close this too. Sorry. I am one of the co-founders of Celiac Cruise, and, you know, I'm going to try and keep this brief, but essentially, you know, Celiac Cruise was created because of, first, this little boy here on the right. That's my son, Peter. You know, he was very, very sick for a very long time. We were struggling to kind of figure out what was going on with him. And lo and behold, I know many of you connect with this story. It was celiac. So then we started to travel and, you know, saw some challenges that went along with that. You know, not only, oh goodness, what if we get sick, and how much do we have to pack, and all of the joy and relaxation that's supposed to come with travel all of a sudden felt like some work. And this was before I knew Erin. So, but thinking about also, you know, we had later diagnoses in the family. So in addition to the safety, you know, we started to think about, gosh, how can we just feel normal again, as opposed to having to have that 20, 30 minute or 20, you know, seconds conversation of this, I need this. So the story of Celiac Cruise is a little bit essentially I'm a mom, I'm a spouse to people I love very much with celiac disease. We had many family diagnoses following the initial two. I ironically used to work in a hospital doing upper GI. So it's kind of funny that now I'm a little bit in the other side, but travel was always a big part of our family. I have 3 little ones, and also giving Peter and my other family members just the chance to really relax on vacation. So Celiac Cruise evolved because of that. So this lovely lady here on the right, her name's Connie Saunders. I met ironically on a cruise, and Connie's always done amazing, like really special large group travel. And I came to her and said, what if we created this experience in which our guests could really just unplug, feel like it used to be, and create this vacation experience for them. So this is kind of what Celiac Cruise is about, to create this, cohesive community of togetherness as well. Not just, obviously safety is utmost importance. But also one thing that's really been amazing is watching our community connect, because we have this natural thing it's that natural icebreaker that's already there. So how we do this, yes, there's a lot of different steps. This took a lot of years to kind of put together, because again, like as a mom, we go into this journey of not really trusting people. I mean, that's been how it's been with restaurants and things like that. So, I had to look at this from my perspective as a mom. How am I going to believe and trust these people that they're really going to keep my family safe? So, it was a lot of different steps. Our partners, cruise partners are Royal Caribbean and AMA Waterways. And ironically, someone on the inside at both companies has been impacted by celiac disease. So I think that has been a big blessing in terms of just, understanding the importance of all of this. So, what we do, we meet with the entire culinary team months out to just kind of go through the operations perspective, and they take it so seriously in that there are certain ships that we cannot use, because there is really no way that they can guarantee the flour is not going to fly from different locations. So we have a specific ships that we're able to use, and some that we can't use because of that operations perspective. So we have a traveling chef, executive chef, and a pastry chef that always comes with us, because as we all know, you can't just pick up one day and say, okay, here's gluten-free flour, go make this, so they stick with us, which has been amazing through a lot of the sailings. Prior to the sailing, immediately before, we take a trained professional. There's Vanessa Weisberg from Boston Children's Hospital. She will come on board, and we train together literally anyone who's involved in the care of our guests. So the crew, the servers, the bartenders, chefs, dishwashers, the kids clubs as well. Everyone is trained, and they have a general understanding of why we do what we do now. And the trickle down impact that I think has been really amazing to watch is, there's 1,300 on the last ship that we did. And, that these people at some point are going to transition to a new job, whether it's in hospitality or a different cruise line. But we know that 20-minute Oh, there's Siri talking my watch. Sorry. That we know that at that point they are going to get some information of celiac, and hope that continues on through how they're going to interact with guests moving forward. We review the ingredients in the menu are vetted and reviewed. So, okay. And you can see there in the top left picture, we're down there with the menus in like the belly of the ship saying, okay, exactly what is going in this? What are you using for this? So all of those boxes are checked. We check the straws, we check the mixers, we check literally everything. So really you can come on board and not have to think about those things. A galley is closed. There's no gluten allowed. There's signs all over saying, no gluten allowed in this galley. So that's been, they take it incredibly serious. There's site inspections, there's protocols, there's a lot of different things. So we take it very serious. So essentially what Celiac Cruise offers, we have, as I said, we work with Royal Caribbean as well as AMA Waterways. The Royal Caribbean ships are, a portion of the ship is dedicated gluten-free, in that the galley or the kitchen it's called a galley on a ship, is gluten-free. So we have specific areas, but we also have unique offerings that only our guests have access to, which include, a late night buffet that is only offered for our guests. So being able to, I'm hungry again at 10 o'clock. What do? We have this offering on the Royal Caribbean ships. The Waterway ships or the river cruises, primarily in Europe, those are complete charters. So all of the gluten is removed. There is, everybody's eating gluten-free the entire time, the crew, no one's bringing gluten on that ship. So that is something that, it's a smaller ship and that's how, that is operated. There's our private dining rooms in which the menus are 100% gluten-free. We do, obviously, with the comorbidities with different, dairy and things like that, people are able to accommodate that as well. So that's a common question we get. So dairy and other things, we do have many guests who travel with additional dietary restrictions. We have evening gatherings for all of our guests. I think that's something that, it's really neat to watch this community connect, and whether it's the kids or the adults or the parents, we really see, we have a lot of people who are traveling individually and they connect and find other solo travelers. And it's just a really cohesive experience. And a lot of people, the friendships, they go back and see each other. So we always have opportunities for people to socialize, to talk about this as much or as little as they want. The other thing here, we have educational sessions. I think my background in healthcare, I am becoming a mom at a certain journey of a child with celiac disease, and how, you do really go to social media. And it really was frightening to me to see, I think, how many parents of newly diagnosed children are getting that education from social media. So it was something in the beginning that Connie and I knew that we always wanted to have a part of this, should you want to attend or not, but we will always bring a medical team on, celiac leaders in the community. Dr. Verma is coming on our cruise in end of June here, and I think her daughter's joining as well. So we'll have that opportunity for you to learn a little more, should you want to, if the slides are calling your name and you're not up for it, but it will be a part of what we offer. We work with lots of different amazing brands, Char, Holidaily, lots of other brands in the community. So we're always going to incorporate their products into our events. And we do some philanthropic things to help families who can't afford the gluten-free diet have access to gluten-free food. And I'm going to keep rolling because I know time is moving. So here's just you can see all of this information on our website, celiaccruise.com. We have sold out a lot of the cruises this year. There is an Alaskan cruise, the second that week, July 28th through the 4th. We have a few cabins left, but you can see all of the different opportunities that are coming in 2024 as well. So that is, a big part of what we do is kind of like I said, the community. And, we do want to take some time to answer questions. I'm going to check my clock. We're 2 minutes over. So why don't we go ahead and answer some questions if you have any.
Yeah, that would be great. If you want to put any questions in that question and answer box, the Q&A at the bottom of your screen, that works best for us, better than the chat box. If anybody has any questions for...
I'd like to add, Maureen, any mention about what you are doing with food insecurity?
Of course. No,
I think that's a really important thing. We've talked about cruise, and cruise is fantastic, and all that fun stuff, but there is some other things that the Celiac Cruise Group is also funding. And I think it's important for people to hear that you can have fun and do other things.
Yes. No, a big part of what we wanted to do is be able to give back to our community. And obviously we all have learned so much about the issues with food insecurity with so many families not being able to afford the gluten-free diet. So each cruise, we do some type of philanthropic event and have committed, I think at this point, we've fed over 700 families across the United States. So there's multiple hospitals that are involved in this, as well as the University of Chicago. So we are actually getting food directly to these families' doorsteps. So, we have some fun things. Last time we did a silent auction, raised $25,000 on the ship and was able to, give that right to these families. And it's in time, we'd love to be able to bring a family on board that might not be able to do that on their own. So it's a big piece of what we do. And it's really it's an awesome opportunity. So we encourage you, if you join us on these cruises, to be a part of that. We're also going to do some stuff from afar as well in the coming cruise in June.
Perfect. Wonderful. Okay, so we're looking for questions for Erin and Maureen. Either one. Maureen specific to celiac cruises, and Erin travel in general. Oh, there's a big thank you here. They're excited to travel in June with you. Questions? Not really any questions coming in. You both did beautiful presentations, so I don't know that you've left much.
Oh, good. Well,
somebody here is asking which cruise ships have been trained.
So any sailing that we have been a part of. So we've been on the, Mariner of the Seas twice, the Symphony of the Seas. This past February, we were also on the Ovation of the Seas last July. But something to note, a lot of the crew who are involved in the F&B, the food and beverage component, they're on contracts, so they don't necessarily stay with the same ships. So kind of going back to that point that I made earlier is, it's been really neat to see, even sometimes on social media, guests will be like, I was on the Ovation, or I was on the Harmony of the Seas, and they had a training on a previous contract, because when they come back on their contracts, they'll go to different ships. So eventually we hope everybody has had a chance to learn about celiac from our training, but those are the specific ships to date that we have sailed on.
And Erin, it looks like maybe this question you could field. Have you been to Lisbon or Portugal, and what is it like, the gluten-free options there?
I have not been to Portugal yet. I would love to, but I will say there is a Portuguese Celiac Association. So one of my recommendations is, for whatever country you are going to, look and see if there is an association, because these associations tend to have a lot of information. And I'm actually going to put in the chat here the link. So I have not been, but I would like to go.
I actually have been to Lisbon, and it was very, very gluten-free friendly. They speak English. That always makes things a little bit less complicated. They understand what you're saying pretty much everywhere. Things are all marked in English as well. And yes, it was a very successful trip. Lots of gluten-free options there.
And Maureen, I'm just wondering, do you do cooking classes on the cruise ships themselves?
So we have done those. We actually, obviously with the return from the pandemic, the rules were kind of specific as to what we were able to do on board, but we are starting to incorporate that. So yes, this past February, we did a cooking demo with Char. They made, now we call the world famous, show brownies. So we were able to do a cooking demonstration with that. And then everyone had the option to have that at dinner that evening, so they could kind of incorporate what it tasted like in that environment. On the river cruises, we did macaroons. And so, yes, it's a big piece of what we all know we care about. And, so that's definitely a big piece of it.
That's awesome.
Perfect.
Great. These were amazing presentations. Thank you. And hopefully, again, recordings will be up on our YouTube, so you can listen again, and, we'll capture any materials we can forward on to you as well. But these were jam-packed with information, so thank you. I would love if we could invite Priyanka back on screen to join us again. And Dr. Chu, would you like to maybe share with us a little bit? I know you touched upon this when you were talking with Dr. Verma, but really let's dive into maintaining relationships with friends and family and significant others. And I think this is such an important topic for people managing celiac, but we're so happy to have you back.
Thanks so much, Rachel. I will share my screen and I will go quickly to get us back on track if we can. Let's see. Can you see my sad puppy?
Yes.
Okay. All right. So, like was said, my name is Priyanka. I am a general surgery resident, which is where the MD and all that goes into play, but that's not what I'm here to talk about. So I was diagnosed with celiac disease when I was 12 years old. And because of that, I've gone through a number of different types of relationships, friends, college roommates, significant others. And I'm here to talk to you a little bit about my experience with that. And sometimes it feels like a happy, peppy dog, but other times it feels a little bit like this cute guy right here, where navigating food situations can be tough and can make you sad. And I'm just going to go through some of the things that I found to be successful in my journey. There we go. The thing that I always say almost anytime I'm talking about celiac disease is that we live in a society that revolves around food. And I'm sure you all experienced it. We've talked about it a lot already today, but almost our entire social experience is food related, especially, you go out to dinner with friends or you have a cup of coffee and some snacks. And so when we talk about relationships, it all really revolves around food. And my two tips that I sort of come up with whenever I talk about this, if my screen would continue on, sorry, I think I'm having some Wi-Fi problems. Let's see. There we go. So in order to navigate this world, there are two tips that I share for those of you who are patients that can sort of help center you in this journey, and for those of you who are parents. And these could potentially be some guiding principles for your kids. So first is to know your disease, and second is to know yourself. So knowing your disease, this is going to help in every situation. Arming yourself with information and practicing ways to share it with other people only really helps relationships. I'll say, despite being diagnosed when I was 12 and being involved in celiac advocacy for this entire 19 years, it's taken me quite a long time to get to a place where I feel really comfortable sharing this with people. And sometimes I get tired talking about celiac disease or having to share the same information over and over. And that's when developing your elevator pitch and your little speech that you can give to people can help. And so just an example of what I share with people, I say something along the lines of, I have celiac disease. It's a genetic autoimmune condition. That means I can't have gluten. And gluten is in a lot of things like wheat, rye, barley. But that just means I have to pay attention to what I eat. I might have to ask some extra questions if we go out or if we eat somewhere new. And obviously that's just a basic version and you can tailor it depending on who you're talking to. But I've sort of practiced saying this over and over again, used to back in the day practice in a mirror to not be so awkward about it, because saying genetic autoimmune condition sounds weird. But you get into the habit of talking about these things, and then you have to get prepared for questions. So I think that people sometimes, again, don't know what those words mean, don't know what gluten is or what it's in. But having the answers to those questions is only going to help you feel more confident and help you build better relationships with people in the future. And I think on top of that, when you get tired of talking about it all the time, that's when you teach other people those speeches. And that's when you connect with other people. That's when you develop your relationships with other people to the point where they can help you with your speech. And I talked earlier about my sister, but it goes with my sister, my college roommate, my partner now. Everyone is familiar with this language and knows this lingo, and that only helps strengthen my relationships with them and helps me interact with new people. And then the second most important thing I think is to know yourself. I think we all manage our celiac disease differently, and we manage our social interactions around celiac disease differently. Like for some of us, it's really important that everyone knows, and it's really important that everyone is on it and has all the details and is advocating for you at all times. Other people would rather not have people know, would rather not have it be such a big part of their life or shared as much. And I'm going to talk to you a little bit about how knowing myself and knowing my disease kind of impacted my journey from when I was diagnosed when I was 12 now to being a physician and working in medicine. So first, friends in school. When I was in middle school and high school, what I knew about myself at that time was that I did not want to stand out. I didn't want to be different. I didn't want people to look at me and wonder why I was eating something that was different than theirs. But what that looked like for me was eating before I went to a social event or packing a lunch. I know for other kids who have celiac disease who I knew at the time, for them, it looked more like, oh, if everyone in my class is having a cupcake, I want a cupcake. It's different for each person. But I think that the urge and the feeling that I felt when I was in middle school and high school was, don't stand out. I don't want to stand out. And I think that this is where the communication started early. So this is when it was an important step to learn how to do my elevator speech and to how to talk to my friends about it. But I still didn't talk about it too much. I didn't want it to be a thing. My close friends were aware and they knew. And then especially as I got into high school, they helped me pick places I could eat at if we went to hang out somewhere, or they would ask me to pick. And when they didn't, I didn't want to make a big deal out of it. But this was all about knowing myself at the time. And thankfully, my family really respecting that too. I didn't want to make a big deal and they didn't make me make a big deal. So I think that this was the point in which I just wanted to fit in, hang out with my friends, be a normal kid. But then going to college, things got a little more complicated. So knowing myself, my main goal, don't stand out, don't, make a big deal, but also don't get sick, right? That's, comes down to it at the end of the day. Before, when I was in middle school and high school, I could hang out with my friends, not eat anything for that time, and then go home and know I had a safe meal. But the relationship with my roommate was going to be confronting this issue because I was going to be living away from home with somebody else, where I had to figure out how I can not make a big deal out of things, but also don't get sick and manage my safety. So I think the most important thing to do when you're living with someone is communicating your needs. And knowing myself, it was really important for me to feel safe in the living space. So I was thankfully able to get a dorm room that had a kitchen. And then I very aggressively labeled all of my food gluten-free. I put green stickers on everything that said gluten-free. My toaster had gluten-free written on it. And I communicated all of that with my roommate. And now I personally didn't feel that I had to be in a completely gluten-free or allergen-free space. But if you know yourself and that makes you feel safe, then it's important to look into that option too. So you can ask my college best friend. She's still one of my, or my college roommate, who's still one of my best friends to this day. I came off a little strong. I labeled everything. I was a little aggressive, but framing it that way and framing it in the context of a medical issue and explaining to her, not just that if I eat something that's, cross-contaminated or that has gluten in it, that I'll get sick now, because I really don't have symptoms, but that it'll be a long-term issue, and explaining it to her when she's, a 17, 18-year-old person, just like I was, she was able to understand that. So I think, all my education that I armed myself with before, being able to communicate that openly, I think actually brought us closer. And like I said, she ended up being a person who could really advocate for me, especially as we were, going through college and I was having, difficult times finding things. She never made me feel bad. She always, helped me find dining halls that I could go to. And while it was really scary to have that conversation, especially when you're going to college and this is, everyone's in a new space, everyone's trying to figure out what to do. It's extra nerve-wracking and you have to be extra vulnerable, but I think it made a huge difference in building that relationship and in making a lifelong friend. And I think on top of that, I don't really have symptoms, but for people who do, communicating those things early about what might happen to you if you were to get sick with somebody who's your roommate is so important, because if you do get exposed to gluten and you're not feeling well, having this person be like totally shocked, like, oh my God, I don't know what to do, is going to damage your relationship. But if you share all of this ahead of time, like, hey, this could happen to me, it helps them be prepared. It helps them know what to do. And it helps you not have to explain things and advocate for yourself when you're feeling sick. So I think that, again, pretty much the big message here is communicate early, even though it's uncomfortable, even though it's awkward. This is the time when the don't stand out kind of has to get put on the back burner, and making sure that you don't get sick is more important. And then comes dating. Again, the biggest thing is knowing yourself. Most people still, again, don't want to stand out. Although for me, that's become less of a problem. I've sort of adapted to an attitude. If you don't like me for who I am, then don't want to be around you. But it's difficult and you don't want to get sick. And then now you have to try and find a partner. So there are some really staggering statistics around dating with celiac disease. There's a recent study that came out from Colombia that showed that nearly half of the people 18 years and older who have experienced dating while having celiac disease hesitate to go on dates. 1 in 5 say it's not enjoyable. 40% say they're uncomfortable explaining their gluten-free needs. 30% of people take risks, and 8% have eaten gluten knowingly. And I think that this is, again, really knowing yourself and knowing your disease. If you can put together your little elevator speech in a more comfortable way that you can share it on a date, it makes it easier and it makes it a little simpler to walk in and say, like, these are my issues, matter of factly, don't make it a big deal. This is just who I am. And if that person has a problem with that, kind of telling you something about them. I think, you know, if this person's not going to be someone who's going to be the type of person to support you, this is probably a person that you don't want in your life. At least that's my, you know, thought process that I've sort of taken around it. And I know it is very awkward and very vulnerable to have to talk about GI problems and things that are not the cutest thing to have to talk about, but it's so important to do that early, because with friends, with roommates and things, it matters, but those people might be transient people in your life. Your person you're dating or your significant other is someone that you're going to be spending a huge portion of your time with, you're going to be having meals with, you're going to potentially be living with, having to share a kitchen. Knowing all those things up front is super, super important. And then I'd say last, it's really important to find a community. And so this has been touched on a lot so far about finding a celiac community. It doesn't have to be a celiac community. It just has to be your people who've stuck with you through the tough times, who try to understand your disease, who try to help advocate for you and try to help make things go more smoothly. So when you're having those rough days with other people or with new social situations, they're the people you can fall back on and who can help guide you through it. And for me, I found this community in a few ways. I mentioned all of my support, my family, my friends, my partner. But then there's also the celiac community that I've been a part of for a long time. And so when I was first diagnosed with celiac, I actually went to celiac camp. And this is where I found some lifelong friends. So these are all people, or a number of these people I still talk to this day and, you know, communicate with on social media, and we all share foods and we talk about things that we've gone through. And then I also made a blog that's been alluded to a couple of times, and now it's on Instagram and Twitter, but it's become a real hobby for me to take pictures of food. But I've made some lifelong connections and friends through here too. And so these are all places where you can find the social support that maybe you don't get in your day-to-day life or with the people who are around you. And so I want to end by saying that I know that navigating social relationships with celiac disease is hard. It's probably the hardest thing we have to do with this disease. But the key is, first, knowing your disease, and second, knowing yourself. And then the tips that you can have are, one, communicate early and often. It's really important that people understand what you need and what you're comfortable with. And give yourself some grace. There are going to be days that are really hard, and there are going to be days that you really need to lean on your support system. And that's okay. You don't have to do everything perfectly all the time. We're all human. And 5, finding your community, those people that you can lean on when you're having those tough days and things are awkward or difficult, is also going to make things so much better. So I kept that kind of brief, but we wanted to leave some time for questions if we have it. And I want to thank you all for giving me the chance to share.
Priyanka, that was awesome. Thank you so much. Thank you. Thank you. I hope everyone, please put questions for Priyanka in here. I have a question for you. Just as you've what are tips for people in those transitional times of life, and a tip for them like managing a chronic disease like celiac?
Yeah. I mean, I think I was diagnosed in a transitional time, right? I was diagnosed when I was 12 years old. I went right through teenage years and college, which are the biggest transitions for me. And I think, honestly, the biggest tip I can have is to just give yourself grace. That number 4 that I had on my list, because I had a lot of times when I was feeling down and I was feeling awful and I felt bad for myself, and I needed my support group and my community to help lift me back up. Because I think that you're already going through so many transitions at that point. You're having to, find new friends if you're going to high school, or, going to college and living in a new place away from your family. It's already hard. And then I think just accepting the fact that every day is not going to be perfect, and that some days are going to be harder than others, but having those people around you who are going to support you. Like, I remember in college, I don't know what came over me, but one day I just really wanted chocolate cake. I don't know. And I lived in New York City, thankfully. So it was not the most impossible thing to find a gluten-free chocolate cake, but it was late at night and I just was like, man, and I was like getting so beat up about it. And I had some really good friends who were like, let's go. And we just like went outside in the winter and went to go find a gluten-free chocolate cake. We couldn't find one, so we've got a mix, and then we baked it together in the middle of the night. Like, things like that, where there's your community of people who lift you up. And I think that finding those people, and even if those people are virtual or those people are through a support group or the transitions group that you all have, like that's I think how you kind of get through it.
So tell me a little bit about celiac camp. And
Oh, yeah.
is this something your mom, Dr. Verma, like had you, like, pushed you and your family to go to, or is this something you enjoyed going? How did you get involved? Tell us, like,
Oh,
please let me hear about it.
I loved it. I mean, I think that I went right after I was diagnosed. I think they luckily had an open spot or something. I don't know. My mom can elaborate on that, but there's an opportunity for me to go the year I was diagnosed, which was incredible. I mean, I think that it was this like revolutionary experience where I just felt like a normal person. Like, especially when you're getting diagnosed, you are like, everything feels foreign, everything feels awful, everything feels like I am not a normal kid anymore. I'm not, I can't do anything that everyone else can. And then I just get to go to camp where it's a regular camp, but the food happens to be gluten-free. I think that was the key. It wasn't like we were sitting around talking about our disease all day long. We were just having a camp and the food was gluten-free. And then, organically connections come up where it's like, hey, how do you feel about this at school? Or, hey, how do you, things like that came up. But it wasn't the like structure of it. And then our whole family went after that. So I went the first year, and then my mom and dad went as counselors. My brother went, and because all four of us were going, my sister, even though she didn't have celiac disease, came too for a couple of years. So it really became a great family experience, and it was amazing for me.
I just want to answer that question, Rachel, about did the mom push? Mom did not push. In fact, I was quite shocked. It was Priyanka who brought that to the attention of the family that she wanted to go to this camp, and she was diagnosed in May. The camp was that summer, and mom was shocked and overwhelmed. And honestly, I could say, really, is this the right time to do this? So my instinct was, don't do this right now. And the headstrong young lady said, no, I'm going to do this. And not only does she have celiac, but she also has all the nut allergies, peanuts, tree nuts, everything. Yeah. So as a mom, I did not want her to go. This was something she brought to us, and my husband said, let her go. And she had a great time.
And then we all went.
It's amazing. And I want to give a nod. I know farther back, there was a mom who posted about her child having type 1 diabetes and celiac. And I just want to also say there are diabetes camps also for kids, and they specialize also with celiac, because as we know, there is a connection between type 1 diabetes and celiac disease. So what I love is that, these camps, Priyanka, you said it best. You're just like everybody else. You take kind of the elephant out of the room, and you just get to be yourself and learn and navigate and have people to relate to and build connections. And I think it's a beautiful thing. So I'm so glad someone asked that, because it's a great thing. And no matter what your kids are dealing with, I think it's wonderful. And Erin talked about how she was a, volunteer at the celiac camp. And I think, if you have children, look into it in your area. Sometimes they're a week, sometimes they're longer, but there are probably regionally different like takes to things. But I know just from experience, a lot of our medical teams and resources and people volunteer their time because they want to go and help. And so I think it's a really wonderful way to receive education without feeling like education and support. Yeah. So,
and I can also tell you that if you've never been to camp like me and are really very concerned about being at camp, eventually it was a great experience. And we went to Rhode Island, and they had some children with diabetes and other conditions as well that managed. So I think we want to normalize as much as possible our children's experience.
Yeah. So one thing that's come up, and I think we can cover this maybe together, but they are different. First, I want to talk professionally. As you and Priyanka, I'm going to look to you a little bit. And, how do you navigate professional events, dinners? They're asking for navigation tips, and we can even bring in drinking a little bit in here, because professionally, as we get older, alcohol is involved. So how do we kind of navigate that? How do you handle ahead of time? Do you let the organizer of the dinner do you let them know? I'm going to let you take it from here and give some tips.
Yeah. And I saw there was a question about, I think, interviews somewhere in there too. So gone through all these things. So I mean, again, I'm in a kind of unique situation because I'm in medicine and we do interviews in a weird way when we're trying to go into residencies. There's a match process and you basically do a ton of interviews in a short amount of time and fly all around the country. And that was awful. Like, I'm just going to say it was terrible. I mean, it was exhausting, and it was a situation in which I was going to lunches and things where I didn't have any options. I think what I started doing initially with that was reaching out, and I do the same thing for dinners now. As I reach out to the coordinator for the interviews, it would be, you know, the residency coordinator or for, you know, any other job, whoever's organizing the whole day, and just say, these are my dietary restrictions. And same thing for dinner, and then ask if they would be able to be accommodated, and then, you know, go from there. I will say a lot of times, even when I was told they would be accommodated or was given sort of like a lukewarm answer, I pretty much always ate before anyway, just to be safe. Because the worst thing is to go to an interview, a professional dinner, and be hangry, which is what happens to me. So I get very tired and I get angry. And so I don't want to be in a professional setting in that way. So always eating something beforehand if I could, or like some of our interview days were really long. And like, I would just tuck a few like gluten-free granola bars, breakfast bar kind of things into my bag and just go to the bathroom and eat it, which is like not a very lovely way to do things. But I found that was the way not to bring too much attention to it, but still be able to eat and you know, have you know, a decent experience. I think that I've, again, had very hit or miss kind of experiences with people being actually able to accommodate. So planning ahead so that you are not caught in a situation where you're really hungry is really important. And then, you know, again, if you're going from city to city, like I was, finding where you're going to have dinner, like just plan it ahead that, you know, you're going to go to this place after the interview, or you're going to order from this place, or having someone like your sister, like I had, who can call places for you when you're exhausted after doing all of that, was what I kind of did to navigate those situations. And then as far as like alcohol, you know, wine is a great go-to. That's pretty much almost always gluten-free. I know there's some like hard liquors and mixed drinks that you could do. I think just as long as you steer away from beer. And there's also no problem in, I mean, I think mocktails are very in. So I've been very into doing that. And, you know, you can always just have a soda, have a, you know, whatever other option that you know is safe. And it kind of comes to my same process with, you know, significant others and with roommates. Like, if people are going to have an issue with you because of your dietary restrictions, then they're really not people you want to be around. It's not an environment you want to be in, especially as you're interviewing and going forward and things like that. These are going to be long-term relationships that you're building. And I think that, you know, saying your needs as it is, not making too big of a deal about it if you're uncomfortable with that, but just stating it as fact, and then seeing how they handle it is always very telling to me too.
Yeah. And we just had an adult happy hour for Celiac Awareness Month on Monday, and had an awesome with Lori Wellstead, one of our dietitians, and the whole place was gluten-free. It was so fun. And it was great to connect with like 35 different people from the Chicago area. It was in Wrigleyville. There are places out there, and I think you have to do a little digging, but this community is so tight knit. I think just also finding bars and, you know, other things that cater to, not that you can go out anywhere and have alcohol, but this was really fun. And they had food and everything was gluten-free. It was lovely. So
there was a question about, do you tell people ahead? The question disappeared. So I guess I'm going to just kind of go from memory.
Yeah.
The question about, do you tell people if you're starting a new job or something? I might be totally butchering that question, but I think that was the gist of it, is do you tell people ahead of time whether you have celiac disease or not? I think it depends entirely on the situation in terms of how big the company is, how inclusive they are. So you already know that in terms of that company, but it's a job that you really want. So I know Priyanka said, if you don't like the people, walk away, but sometimes you've got to be in that community, whether you like them or not, because that's a job that you like. So in that case, I think if you get the vibes from a company that they're not going to be happy with having to deal with any dietary things, first of all, yes, find another company to work. But if you really want to be there, then I probably would not bring it out the first time. But if there's going to be a meal, then I do think it's very important to let someone know, because, you know, two things can happen is that when the meal comes and you're not eating anything, then somebody is going to say, oh, why didn't you tell us? And then people are going to feel awkward about it. So I would say mention it to somebody, and then always have a backup sandwich or something with you. And it's totally fine so long as you mention to them ahead of time. And then when you open up your sandwich, don't look like, woe is me, I'm eating this while you're eating all that, because you don't want to make people feel uncomfortable. If you make others feel uncomfortable, then they're not going to want to be with you anyway, but they might learn from you if you are just sort of embracing the atmosphere and then educating them. So I don't know, Priyanka, is that something that works for you when you're in those situations?
Yeah, I agree. I mean, I think that it comes to knowing yourself too and what you want out of those situations, right? Like if it's more uncomfortable for you to bring your sandwich and open it at the table and you're going to feel weird, then don't do it. And just say that you already ate ahead of time because of your allergies. Like I do that very often. Or, there's always a bag of chips, right? There's always some Lay's potato chips. Like there's always not always, often there's something that you can have, or just have a glass of water or whatever. And I think that having that confidence and just owning it, I think that that's what puts others at ease. And I think that we all worry about being a burden. I worry about this a lot. And I think that, knowing yourself and how much you want to interact with people in that way, and how much you want to ask of people, and how much is acceptable to ask of people in your environment is important. But either way, taking all of it with this confidence and airs of, I'm fine. Like if you're the one who's having a problem, I'm fine. So let's just relax and enjoy and do what we need to do, and kind of, put it in that way and try to offload the pressure. Then I think no matter what, you won't come across like a burden, and you won't come across like too difficult or anything like that. So that's what I do, at least.
Thank you. This was awesome, Priyanka. It was such a pleasure having you today for multiple discussions, and you lend such great insight into everything. So thank you very, very much. We are going to close out with our final panel. I'm really excited. Dr. Verma, don't turn off that screen. We're going to have you, and I'm going to welcome Lindsay Yackel, our educational coordinator. And I'm so excited to invite Dina Goldberg to turn on her screen. Dina is Shane's mom. Shane was the young author who joined us earlier. We're really excited to have Dina join us. And then Anya and Ainsley, two of our amazing rock star founding members of In Transit, who are going to be joining us for our restaurant panel. And what I'd love to do is just talk to each of you a little bit quick first on, Anya and Ainsley, I want to come to you first of just your perspective as teenagers eating out. Can you talk to me a little bit about like what fast food places you feel comfortable, what you like to order, where you like to go out? And because it's such a big part of your life, I would love to hear from you, just like hanging out, eating out with friends. And let's start. Why don't you go ahead first, Anya?
Hi everyone, I'm Anya. So with eating out and stuff, I found that with time, it definitely gets easier. When I was first diagnosed at 12, it was definitely a lot more challenging. The whole having to talk on the phone was really scary for me. It still kind of is sometimes. It's always a little awkward when you're trying to explain to someone and they don't really understand what you're doing. But I've found eating out isn't always as bad as it seems, and most places can accommodate for celiac to some degree. The way I always check is I use the ThymeGF app. That's like my favorite go-to app, because you have people who have like already that have celiac that go there, they write the reviews, they say whether it's safe or not. And that gives me a little bit of reassurance that like, yes, the staff is educated, yes, that they have training about this. And that's like usually my cushion. When I go to places that are like open, like buffet style, I try to avoid those. Those tend to be where all the cross-contamination happens, because people obviously are touching multiple things, and it's really hard to make sure that nothing has been cross-contaminated. Places like Chipotle, Roti, I'm trying to think of others where they have it kind of out. I always ask to get stuff from the back, because for me, that's the most comfortable thing. I don't know if there's been a burrito that's been touched or what has happened while I haven't been there. Sit-down restaurants are usually a little easier. I talk to the manager, the chef, that sort of thing. But with those restaurants, that's usually my go-to with that.
Thank you so much. And I'm coming back to you. But first, I want to hear from Ainsley. If you want to share a little bit about eating out with friends and, when you're going out and how you prefer, pick a restaurant, things like that.
Sure. So, just like Anya said, I also use the Find Me Gluten Free app, and I have like pretty much ever since I was diagnosed. My mom found it early on, and I just check every restaurant before I go. My friends are really great about letting me like choose a restaurant or checking with me about a restaurant if we ever go out. So definitely talking to your friends about it and making sure that they know like how serious your celiac is super important. And just communication also with the people at the restaurant, like Anya said, like no matter where I go, I always let them know, and make sure that there's no cross contamination.
That's great. Okay, so Ainsley, tell me, what's your favorite place? Where do you love to go? If you get to pick with your friends, where do you prefer to choose?
Well, Anya kind of mentioned Chipotle and Roti. Like I literally go to both of those places really often. I just like it's not really fast food, but it's just like really good and they have a lot of options.
That's great. And Anya, tell me a little bit. Have your friends, do they keep you in mind when they're picking places to eat out?
So I think it's pretty different with my friend circle because I've always been very, very open about having celiac. My whole friends group grows. Probably half my school actually knows that I have celiac. I talk about having it a lot and some of the struggles and stuff like that. But as a result of that, whenever we're going to pick a restaurant, I get a text from the host always that's like, which restaurants can you eat at? We're gonna go wherever you can eat. With homecoming and school dances and stuff like that, when we're doing group events and we're picking a restaurant, it's almost become standard that I like provide a list of places and then we go through those lists and we all decide as a group which one we want to go to. And that's kind of how it's been for everything. Everything has like run by me first. And it's been really, really nice. I think I have like a really good support system as a result of that. And it honestly feels good. I've never, when I'm like hanging out with my friends, had to worry about whether or not my food's been safe because they've been like so good about it.
That's awesome. So Ainsley, I'm going to have one last question for you. And then I would love to hear Dina from your perspective as a parent. But Ainsley, tell me, when you are, with friends, Anya, you touched upon like bigger things. What about Ainsley? Tell me about sports or activities. How do you handle food in those stories? If like your whole team is going to go out after for a meal, do you vocalize like, hey, could we go here? Or how do you handle that?
Sure. So I don't really do any sports, but I'm really involved in theater at my school, and that involves a lot of late nights and like dinners and things. So when we're having dinner at school, I always talk to the teacher or whoever's in charge, and they always provide food for me, or I bring my own food, which I'm so used to at this point, so it's really fine. And then if we go out after the event, sometimes I can just like I don't get to eat, which I feel like everyone kind of shares that experience at some point with celiac, and I have to bring my own food. But some of the times I also like get to say in where the restaurant, which restaurant it is, so I can go somewhere more comfortable. But for me, that has been a struggle, like if I can't pick, and so it's important to like communicate about that.
Absolutely, and advocate. Well, ladies, don't go anywhere. I'm going to transition really quickly because Dina, I would love to hear from your perspective with Shane. How are you empowering him and educating him? He is now at an age where he's probably heading out more. Where, from your perspective, do you stand on eating out, and how do you handle all the education with him?
So now I look as though every opportunity that we go out is an opportunity to sort of teach him how to advocate for himself. One piece of advice is I don't think I transitioned it to him early enough. So for those of you who have younger kids, having them practice when you're out in a restaurant, be the ones to speak, to talk to the servers and the managers, and then you chime in would be really helpful, because the more you practice it, the better it's going to be. The other thing I've noticed is that he, when he goes out with friends more now, like he does it on his own, and the more opportunities I let him kind of fly, for lack of better words, the more he's going to practice it. One of the things that I do as a parent behind the scenes still is I often contact restaurants in advance before even going. So I'll speak to the food and beverage manager even if we're traveling, you never know what they're going to say. Sometimes they can actually say yes. I've had restaurants offer and be willing to bring in gluten-free bread for me, bring in desserts ahead of time, things like that. And you're not always going to get that sort of receptiveness, but sometimes you will. I mean, the best experience I had is we were traveling once and a food and beverage manager actually bought new pots and pans, new strainers, new cutting boards, everything for us, which I was blown away by. So I wouldn't expect that all the time. That's only happened to us once in all these years. But my whole point is you never know unless you ask. So always be willing to ask. And he's gotten a lot better now advocating for himself. And, we definitely have trip ups. We had a situation this past year where he didn't feel good at a restaurant. But, one of our lessons learned is if you get two conflicting answers, always pass. Because this was something where somebody reassured us after somebody wasn't sure, and then that was a problem. So unless you're getting across the board, everybody fully understanding, just take a pass. That would be my advice on that one.
Yeah, I love that advice because it is, I was just going to say, it's not always just positive, right? There are things. And what advice, as you look out to the teenagers and the parents of the young generation here of our kids with celiac disease, what is the best thing? I know you said starting a little bit earlier, but how can you, at what age do you feel like it's okay to walk into Chick-fil-A to order? Like, how would you, what are one or two things that you would send them in at what age, and what can they ask? Like, what are two really good questions that they can ask when they walk into a restaurant? If they're the ones doing it.
So one thing I always focus with Shane on is making sure he understands that he needs to ask about cross contact, right? So, and the other piece is I reassure him that it is okay it's not really fully factual to say it's an allergy, but we still say it's an allergy, because what ends up happening is if you explain you have celiac, they look at you sort of when their eyes are sort of roll over, right? And then if you actually say it's an allergy, then they perk up and then they tune in and then they understand the concept of cross contact. So we talk a lot about that it's not, it's not really a lie. It's just keeping you safe. So that's one piece that we do. And he makes sure to ask that.
That's great. That is awesome. And then Dr. Verma, from your perspective, what are two questions when you're walking into a restaurant that you think kids should always be armed with, kind of as part of their elevator speech? Dina covered, but do you have any other questions you think they should always cover?
So I think, first of all, the kids should have covered it before they come to the restaurant. I think the biggest disappointment is you're hungry and you walk into a restaurant and you ask those questions and you're not satisfied with the answer, and then you have to leave. So I think a little bit of homework prior to coming to a restaurant is important. I know the young people, Anya and Ainsley, mentioned about the gluten-free app. I think it's fantastic. But even then, you want to be armed with those questions. So I would say a little homework prior to that. But when you walk in, I don't think that anyone should be very comfortable feeling like I've been here before, it was gluten-free before, it's going to be gluten-free again. So I think from a child standpoint, you need to be aware that I still have to ask those questions. So I have personal experience with my family where we've gone one time, they've reassured us that dessert is gluten-free, and then you go the next time and you ask, and then it's a different server and all that, and you get a totally different answer. So as Dina said, that's when you go with there was gluten the first time. So always keeping in mind that just because you ate there doesn't mean that it's still the same practice. So always ask the same questions again. However annoying they are, you want to ask the question. And my pet peeve is that gluten-free pasta. You ask, do you have gluten-free pasta? And they say yes. And then out comes, and then you get sick. It's because they boiled that with the regular water. So I think that's a question to ask if you go to eat pasta. But some homework needs to be done before you walk into that restaurant.
Yeah. And I know just from, us in transit meetings and everything, it sounds like to me the best time is after school, before dinner, those in between times where restaurants aren't so busy making those calls. I think people are more apt to pick up the phone and have time to talk to you versus calling during heavy rush hour of a restaurant. I think that is always helpful. Lindsay, for those of you who don't know Lindsay yet, you're going to really get to know her, but she has such a cool background of working with restaurants. She's a chef and also our educational coordinator. We're so excited to have her. I was just wondering from this perspective, what are things that restaurants should be doing to keep our gluten-free guests safe? our
Sure.
senior kids.
So Dr. Verma mentioned one of the big ones, actually, that's the separate pot for pasta, of course, is a big deal. And it's one of the things on the list of questions you should ask if you're ordering pasta. Do you use the same pot for the pasta? You know, is it the same water? Or are you using different pot, clean water, all of that? So that's definitely one of the big things that restaurants should be doing and we should be asking them about. Another one is if you're getting a pizza, which always is tricky, but one of the things that you definitely want to know about is, are they putting it directly on the pizza oven? Is the crust sitting right on the pizza oven, or are they putting a pan under it and then sliding it into the pizza oven? Do they have a separate gluten-free prep space? Is the space cleaned before and after? Are they cleaning their equipment in between uses? You know, some equipment can be shared, but it still needs to be cleaned in between. If they're making something in a mixer, is the mixer being cleaned in between uses? Things like that. And let's see, do they have designated gluten-free equipment, utensils, cutting boards, knives, things like that, that are really important to have designated for the gluten-free items? So that's kind of a little kit that they could have right in that gluten-free space that they have aside from the rest of the kitchen. They could keep a little kit like that there. Are they using separate strainers and colanders? We all know that that's a big area that's hard to clean and hard to make sure is all the gluten is removed. So ideally we want separate strainers and colanders. How are they storing things? Gluten-free items should be stored on the top shelf, in dry storage, in the cooler, in the freezer, all of the places where you're keeping food, you want the gluten-free on the top shelf. In all of my years of doing this, there were a few places that I would say were most of the ingredients were gluten-free and only a couple contain gluten. So in that situation, we would say, keep the gluten items on the bottom and then the rest of it is gluten-free. So it sort of depends on the kitchen, what they're serving, but they could go either direction. We might be sectioning off the gluten containing items if there's fewer of them, or the gluten-free if there's fewer of those. A lot of times we like to see designated plates for the gluten-free meals. So it stands out, the gluten containing meal is on a round plate, the gluten-free meals are on a square plate, for example, something like that, so that the kitchen staff knows that one needs extra care. And then when it comes to the table, it makes the guest feel more confident, comfortable that they actually got their gluten-free meal because it is the separate plate. If not a separate plate, maybe a pick or a flag or something like that in the meal is always nice to see as well. That helps to again make us feel more comfortable that the kitchen staff really paid attention throughout the process and everybody knows. Sometimes it's even nice if a manager is the one that brings the plate to you as opposed to the regular server who's bringing, the tray of all the plates. It's nice sometimes if a manager would be the one to carry it, because then you also, again, know that they've been paying attention to it through the process. Oftentimes places will have a manager watch the whole process as it goes through to make sure everything is kept safe along the way. So those are a lot of things that are nice to see restaurants do. Some of it requirements for gluten-free and a couple of things that are maybe just additional reassurances for the celiac person.
And those are wonderful outlines. I think we have to work within parameters of restaurants, but I think what Dina said that struck with me was, if you get two conflicting answers, go with your gut. And maybe you don't you know what I mean? I think it's just, getting like very succinct information. Lindsay, like if you were at the restaurant, I would be like, oh my gosh, they're good. They know everything to do. But sometimes if someone is hesitant and then they go ask a manager and they're hesitant as well, or just say, yes, it'll be fine. I think just like ask more probing questions. But eating out, everyone should feel good. And as Dr. Verma always tells all of us, like, you have to live your life. You have to go, and feel confident. But I think if you're prepared, if that makes sense, like calling ahead, asking, the questions, it always helps. It definitely does.
Wait, can I add one other comment?
Yes.
It would be the emotional side of things. I would encourage everyone to talk to their kids about what factors of eating out stresses them the most or makes them feel upset or happy the most. For Shane, a lot of it was this tiny little things like that his brother got to eat bread and they didn't have gluten-free bread. So then I started to bring sort of gluten-free crackers, and I would call ahead and ask, and if they happened to have gluten-free food, but they didn't have gluten-free bread, I would bring pouches of crackers. And then I would ask the staff to bring a separate butter from the back, and I would pull my crackers out and give it to him on a plate. So he felt like he could be part of the family and part of the meal. And if I didn't have something like that, sometimes it would set him off and he'd be upset the whole meal, just sort of sitting there moping. And then that's not fun for anybody, right? So every child's going to have something that matters to them. And that might be a nice thing to ask. And use it also as an opportunity, if you have a picky child, which I happen to have, to see if they're willing to try other foods. We went somewhere and he ordered something like he would never have touched at home. And I said, Shane, how come you're trying that at the restaurant? He goes, well, Mom, we're at a restaurant. It's a professional chef. And I thought, great, but it's just an opportunity to just put them in different environments to try new things. So hopefully that can help some.
I think, Dina, that's so, so important in all of our travels to restaurants and other ways to talk to our children, because we go in with our own preconceived what we want to do. And sometimes we are overbearing. Like my children will tell me sometimes I get instructions before we walk into a restaurant. Mom, don't embarrass us. Do not ask any of these questions. And, don't do any of that. Of course, you step in if it looks like it's going the wrong way. Then you do need to step in. But I think it's really important. That point is probably the most important point that we should have is ask our children, what is it that really matters to them? We might think, I used to at one time go to Carrabba's when the kids had just been diagnosed with one of the few restaurants that had gluten-free options, and they would bring out the oil and the herbs, and then they would not have bread. So I used to get bread from Whole Foods, toasted and all, and then take it there. And yeah, the kids liked it, but it wasn't like the most important thing that they needed there. They needed that company and everyone else there. So I think we do forget asking the children, and I'm sure Anya and Ainsley will tell us that as parents, back off, let us tell you what we need. So really important point. Thank you. Anya, you're nodding your head. What would you like to tell your mother?
I think something interesting was a few months ago, I talked to some kids in my school who also had celiac or siblings of celiac, and we were talking about like what is the hardest part of having celiac. And something that really struck out to me was I was talking to this one classmate of mine who everyone in his family except him has celiac. His mom has celiac, both his older sisters have celiac. And he was talking about how the hardest part for him isn't the whole being gluten-free part. He's okay with them like eating the gluten-free food, that most of their house, not all of it, but a good amount of the house is gluten-free. But the hardest part is when you're sitting at the restaurant and he's like, my mom's so embarrassing. She's always calling the chef over. And then she's like, oh, I need to talk to the manager. And she asks him like 12 times, is it gluten-free? Is it gluten-free? And I thought it was really funny because obviously we think of it as like a necessity and it is important, but sometimes it almost feels better when like I do it myself, because I want to know exactly what I need to know without being super like overbearing either, but still making sure that what I'm eating is safe for me. So at least at my house, it's kind of become a point where I'm the only one who orders out food. I order everyone's food. Everyone just tells me what their order is. If we're at restaurants, I prefer to be the one who's talking to the manager and the chef, because I kind of know what I need to do to have my meal safe, and I prefer to have it like be more independent like that.
That's great. So Ainsley, do you have any final thoughts for the group? Any advice?
Sure. So Anya's response was really confident, and she seems very confident in her ability to like talk to people. But for me personally, especially like through my celiac journey, I've had that feeling of like feeling like a burden, and like having to ask all these questions is really difficult. So just kind of recognizing, and it gets easier with time, that like you're not the burden, and like it is something that you need. You're not the one who's wrong about this, like if you have to ask all these questions, like that's something you have to do for yourself. And yeah.
I love it. Thank you. Thanks, Ainsley. And Dina, any final thoughts for our fellow parents?
Sure. This isn't restaurant specific. It's more related to Shane's book, but I would encourage to work with your kids to find some way to give back to the celiac community. And not just because it's good to give, but for Shane, this project initially started because he was tasked with giving back to the world in some way. And because he cares about celiac, he wrote this book, but never in a million years did we dream that writing the book was going to help him in his journey. And it has been incredible, the transition that he went through from really feeling, having celiac really drive his life and be a burden to him, to transition into somebody who feels confidence in it and someone who is okay with the fact that he has celiac. It was very therapeutic for him. And we never in a million years thought that that was going to happen. And it did. So it was truly a gift to us, just as much as we feel like it's a gift to helping other kids. So I would just encourage, even if it's just sort of small, being part of these community groups or being a mentor or whatever it might be, it really does make a difference, not only to the people you're helping, but to your children who have celiac.
I love that. Thank you. And Shane's book is a gift. So I can't wait for everyone to see it. Thank you so much. And Lindsay, do you have any final thoughts?
I just would encourage people to continue to go to restaurants and enjoy their life and just do the best you can to keep it as safe as possible. And I think it's an important experience that everybody should have. Going out to restaurants it's special, and it needs to be able to be enjoyed by everybody. So don't be afraid to go out.
Awesome. Thank you. And Dr. Verma.
I think one of the things that we probably need as parents is to listen to our children. And that really resonated with me, what Dana said. And children can be very different. So one can be as confident as Anya, and one can be a little bit shy like Ainsley, and one can be somebody who doesn't want to talk about this at all. So we have to respect our children in terms of how they respond to this disease. And not necessary that everyone is going to do it the same way. You could have 3 children with celiac disease and one responds differently. And we just need to accept that that's how our children are and support them that way and not expect everyone to be the same. And then to understand what their needs are. One of the things we didn't touch on a whole lot is about 504 plans for children in school and stuff like that. Now, some people, it's so important when you're going through the 504 plans that you sit with your child and ask them, what do you need? Not necessarily that you want to have everyone have a hot lunch, but if your child wants a hot lunch, then let's work on it. So not to embarrass our children and not to make them feel like they're a burden. This is a disease they didn't ask for. They got it. So therefore, we shouldn't make them feel like a burden. But I can also tell you that from a parent standpoint, now speaking as a parent, it feels like a huge burden because every day, every moment, what you're doing is thinking about keeping your child safe, and you can't give a medicine for it. You have to watch out where they go, what do they do, and then have to balance how much do I step in, how much do I step out. So both parent and child need to sit down and have open discussions about how stressful this is. What can we do to make it less stressful? And that's something that I learned through my journey of 19 years of my children having celiac disease. I was extremely stressed and throwing that stress out to them where they didn't really want that. They wanted, let life be and let's just do a gluten-free world. But I had a stress level that I was then transmitting to them. So from my journey, I would say to the other parents, it is very stressful as a parent, but sit down with your children, and it doesn't matter how old they are. You'll be surprised a 4-year-old can actually understand what you're saying, and let's work together. And if it's getting too burdensome for you as a unit, as a family, then reach out to us. Reach out to people who've been speaking here. I know Dina would be helpful. I know Dina has done this for others. I know Anya and Ainsley would be. I know Lindsay would be, and so would Rachel. I know Priyanka is there. And Maureen is there, Erin is there, everyone is there. And of course, the gentleman who will be speaking on Monday. So I think that it's very important that we keep that psychological quality of life impact that this disease has. It is huge. So let us help each other. But I do think that the parents and children, which I did not do when I started on this journey, I just thought it was something I had to do and let's get on with it, and not listening to them. So I hope that I can help someone with that. I know that that's what Dina has always felt. And that Ainsley and Anya have mentioned that as well, along with Lindsay. So that's a long-winded statement, but I do think that the quality of life and the psychological impact of this disease is huge. It's huge. It's more than that gluten-free diet. So let's work together.
Well, thank you. And I think that's the purpose of today, actually, is improving everyone's quality of life and offering resources. And Lindsay, kudos to you and the team for putting together a great day. We could have 6 more of these days. And I just want to note that we want your feedback. We want to continue to build programs that meet your needs and topics that you're interested in hearing about. And during Celiac Awareness Month, it's a timely time where we're trying to always think of different ways to come with education, but we're always growing and changing. And as a center, we want to be here for you and improve you and your children's quality of life and your loved ones and your partners and, spouses. So please let us know how we can better support you and create resources for your families. Today was an awesome day. I want to thank our speakers. It was amazing. It was great. We heard from so many different topics, and I hope that everyone got something out of today. Few housekeeping, this will be posted on our YouTube. We will send up follow-up materials and notes from today. So I just appreciate everyone tuning in, and I hope that people got a lot out of this. Thank you to Lindsay and Dr. Verma for giving so much of your time and expertise. And Lindsay, did I forget anything?
No, I don't think so. There'll be an email coming, just so everybody knows. There's a follow-up email coming sometime next week with lots of information on about what we talked about today, where to find us, our programs. Lots of things will be in that email.
Awesome. Well, thank you. Thank you. Thank you. I know there are a few questions and we'll get to them after this, but we are over time. So I want to be thoughtful of everything. But Dr. Verma, do you have any closing thoughts? No, we're good. This was awesome. Thank you guys. Enjoy your beautiful day with your families. Thank you for tuning in, and please join us Monday. We have another awesome program with the Celiac Project. We're excited, and we have lots going on. So you'll hear from Lindsay with more, but just please join us. We are excited to hear from everyone, and we can't wait to keep building more programming for all of you. So thank you. Thank you. Enjoy your day.
Thanks.
Thank you.